Hello guys, am I audible and clearly visible to you guys? Let me know in the chat box. Sorry for the delay. Am I clearly audible and visible to you guys? Let me know in the chat box. I think it's perfectly going, right? Yes, yes, yes. Okay, 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 okay. So, right. Perfect. ठीक है, ठीक है, ठीक है. So, in today's session, we're going to cover the PSM rapid revision, preventive and social medicine. And our motive is to cover all the important topics related to this subject for the upcoming FMGE exam. I will try to concise all the important topics in a very easy manner, and will cover all the important images also, because this is a very important subject and having a good weightage also, right? 33 marks is in the blueprint, but from 30 to 35 questions are coming from this subject in every exam, in every FMG exam, right? So our motive is to cover this subject. And what is about this importance of this subject? In this subject, just you have to learn by heart the things, and just you have to imply that in the MCQ, right? There is a no need to make a diagnosis, the make the treatment and the other part, right? There will be the should be the some things which you have to learn and which you have to implement it, right? Like there's the vaccines, and you have to in which month you have to give the vaccines, what is the strain of the vaccines, you have to remember that. And they will ask you the MCQ, like for this vaccine will be given on the which month to the baby, and what is the contraindication of this vaccines and other things. About the epidemiology, they will ask you the questions, right? So this is a kind of a good subject that you can make sure this thing, that out of 35 MCQs, surely from 25 to 28 MCQs you can correct from this subject, right? I can understand this is a very vast subject because this is having a too much content to studies. But what I did, I studied all and analyzed all the previous FMG exams, and take all the important topics which are coming repeatedly in this exam. We'll try to cover in this rapid revision to all these topics, right? Are you ready, guys, to cover this subject in an easy manner? Are you ready to, guys? Let me know in the chat box. Let me know in the chat box. Are you ready? Okay. So let's start this PSM rapid revision session, right? Rapid revision session. Okay. And for this, related to this rapid revision or my previous rapid revisions, if you have any query, you can directly contact me on my Instagram. My Instagram handle is Dr. Vaibhav Ahuja, right? You can directly ping me on there if you have any queries. If you have any queries related to the MCQs, related to the anything, you can directly contact me there, right? With this, sometimes you are contacting for the files and other things, so directly you can ping me on my Telegram also. My Telegram is also Dr. Vaibhav Ahuja, right? So this is my personal Telegram username, right? So directly you can write in the search bar this name, and you can directly contact me there, right? Okay, so I will send you the files and other things also, so you can contact me in the both way, on the Instagram, on the Telegram also, for any queries related to this exam, related to any kind of the things, right? Now we are starting this session. Duration of this class, I have the content of this classes. This will be taking 5 hours. Okay, minimum 5 hours classes will be taken related to this subject. Okay, okay, 5 hours. Okay, so starting this about from the important topic. Starting with the important topic is about the vaccines. Every time in your NEET PG exam, in your FMG exam, right, right. So there will be the question from the vaccines. Okay, हमेशा question आता है. Every time that we are seeing the question from the vaccines are coming, right? So in the vaccines question, there is the important thing which they are asking you again and again about the stains of this vaccine. They are asking you about the stain of the vaccine, right? So you have to remember all the stains related to the vaccines. So starting with the name of the stains, you have to remember for the yellow fever. For the yellow fever vaccine, there's a stain which is the 17D, right? I already told you this class will be gonna 4 to 5 hours. 4 to 5 hours, right? 4 to 5 hours will be the duration of the class, right? We'll cover all the important topics related to the your upcoming FMG. It will be very beneficial for you. Just try to be concentrated and do this very well, right? And this will be your yellow fever will be your 17D. If you're talking about the measles, now what you have to do, there is no things to getting you to understand the things that you have to learn by heart, that yellow fever is having the stain is the 17D, right? There is nothing to explain you or nothing you have to understand or make the diagnosis of the things, right? In this subject, just you have to learn by heart. Yellow fever, the stain is 17D. Now the measles, there will be the Admon's Jabri, right? So this will be the for the measles. Now the next is your JE, Japanese encephalitis. There will be the SA 1414-2. Please remember as a 1414-2. Okay, JE 1414-2. Okay, Japanese encephalitis is the 1414-2. The next we have the OP, right? There is the OPV, oral polio vaccine, right? You have remember oral polio vaccine, which is oral vaccine. That will be your 7. That will be your 7. And the IPV, injectable polio vaccine. That is the injectable polio vaccine that is having the SALT. Remember about it. This is a very important. Please remember the OPV, oral polio vaccine, is having the stain of the 7, and your IPV, injectable polio vaccine, is having the SALT. The next we have the rubella. We have the rubella. In the rubella, please remember that would be your rubella. It means the R. Please remember as the rubella first letter is the R, so it will be also the RA 273. 27/3. 27/3 will be your 27 slash will be your stain of rubella. And the next is your BCG. The BCG important one, the BCG, because 2 to 3 times. This is the PYQ. This is your PYQ. Okay, this is a PYQ. For the BCG strain, they asked you 2 to 3 times in the FMG exam, and please remember this is also the important. That will be your Danish 1331. That will be your Danish 1331, right? So again, I'm revising all the things when we'll finish this table, and this is a very important table. Please try to understand this. The next we have the pentavalent, and you can understand panta, it means there is a 5 vaccine will be included in the panta, right? So there will be the panta, it means the 5 vaccine. Panta matlab kya hota hai? 5. So the 5 vaccines, what 5 vaccines are here? Please remember the diphtheria, tetanus, pertussis, hepatitis B, and the H influenza B. So these 5 are including, these 5 are included in this panta vaccine. Okay, so in this panta vaccine, if they are asking you in this panta vaccine which is not included, and they mention any other thing like JE, they mentioned you, they may mention the yellow fever, maybe rubella will be there. So you have to keep in your mind that in the pentavalent vaccine, there will be the diphtheria, tetanus, pertussis, hepatitis B, and the H influenza type B. Please remember, they can surely confuse you about the this question, right? So please remember all these things. These are the important. Like your yellow fever is having the 17D, measles, advanced jagrin, please remember Japanese encephalitis JE is having the 14/14/2. Okay, remember like a dates, like 14/14/2. Okay, and OPV is having the OPV is having your 7, and your IPV is having the SARC. Okay, and please remember the BCG one. I'm again mentioning you here. The BCG is very important. That is the Danish 1331. Okay, now we are moving forward for the next national immunization schedule. This is a very important question. This is we having a schedule, right, for the immunization, which is known as your national immunization schedule, right? NIS. Okay, national immunization schedule. This national immunization schedule is having the vaccines. What kind of the vaccine? This immunization schedule is saying that these vaccines should be given at this age, and you have to remember this all, because they can ask you in MCQs. They can directly mention you at the sixth week which vaccines not given, like that. Okay, so they are trying to confuse you with this all the things, and you have to remember in an easy manner. Okay, so we'll start this and national immunization schedule in a very easy manner. Please try to understand. Just remember at the birth, at the time of birth, just say the baby is delivered, or maybe the cesarean section. So as the birth of the time, you have to give, please remember, you have to give the 3 vaccines. What are the 3 important vaccines? You have to give the BCG, right? You have to give the BCG. You have to give the oral polio vaccine. Please remember, oral polio vaccine 0 dose will be given at the birth only, and your hepatitis B, your hepatitis B also given at the birth only. Your hepatitis B is also given at the birth only. So please remember at the birth which three vaccine. Please try to please try to answer in the chat box which three vaccines should be given at the birth. Which three vaccines should be given at the birth? Write in the chat box. Please make this session too interactive, so it will be much beneficial for you also. Just after the 2 days, you guys are having the exam, and if you cover this content now only, right, you learn with me only here, right, there will be no need to again watch this video, right, you are covering with me now here only, so it will be much beneficial. You will getting the same question in the exam, and you will get to answer, you will get easily answered that this was from the my session, right. So try to answer me in the chat box which three vaccines are given at the birth. Which three vaccines are given at the birth? Please remember the BCG, OPV, and the hepatitis B. Very good, very good. Now, after the birth, there will be the second dose, the second, and your National Immunization Health is saying the second doses will be given at the 6 weeks. But which drug should be given? Please remember, there will be given the pentavalent, and I already told you from in the penta. Please let me know in the chat box. Please let me know in the chat box in the pentavalent. In the penta, what five diseases, what five vaccines are contributing there in the penta? Let me know in the chat box. So there will be given the panta, the first dose of the panta will be given, and they will be given with the rotavirus. There will be the rotavirus will be given, rota one dose will be given, and will give the OPV first. As we given the OPV zero dose at the birth, so now we'll give the OPV first dose. Now we'll give the OPV first dose, and there will the fractional IPV dose one also. Will give the fractional IPV, injectable polio vaccine will be given, and will give the PCV, will give the PCV also, PCV one dose. So now you have to remember penta rota. Please remember penta rota, and we given the OPV, penta rota OPV, fractional IPV, and the PCV. So this should be given at the 6th week, right? So please remember at the 6th week, as a 6th week they are asking how many vaccines should be given. Five vaccines should be given. What are the five? What are the five? Penta will be given, rota will be given, OPV1 will be given, and FIPV1 given, and our PCV will be given. The next, now at the 10th week, they are asking you about the 10th week. This is the most important. At the 10th week, they are asking you what should be given, right? They will be asking you about the about the 10th week. The 10th week is important. They're asking you. So there will be the same things we have to repeat. Please remember the starting wale teen the starting wale teen in the 6th week. Just you have to repeat those, like Panta 2 will be given, Rota 2 will be given, and the OPV 2 will be given. So now it will be easy for you. Please remember in the first birth time we'll given the BCG, OPV, and the hepatitis B. That's it. Then we come to the 6th week. Like 6th week, it means the five vaccine will be given. Please remember at the 6th, we will give the at the 6th we'll give the five vaccines. Okay. At the 6th, we'll give the five vaccines. Please remember what are the five vaccines? Panta, Rota, OPV, fractional IPV, and the PCV. Now just repeat this starting 3-1 will be repeated into your 10th week. So you can see here the Panta 1, the Panta 2 will be here, Rota 1, Rota 2, OPV 1, and OPV 2 will be here. It's easy till here. Now the coming on the 14th week. What will be done on the 14th week? Please remember, now on the 14th week there will be the same which will be given on the 6th week. जो 6th week पे हमने दिया है, just the dose will be given here. The same dose will be given. Like you can see the same thing. The Panta 1 will be given. The Panta 3 will be here. And Rota 1 will be given. Rota 3 will be here. OPV 3, fractional IPV2 here, because we given the second dose of the Panta, Rota, and OPV on the 10th week. Please remember, we'll give it on the 10th week, and the fractional IPV dose 2 will be here, and the PCV dose 2 will be here. So now you can easily understand. At the birth 3, there will be the three vaccines will be given. At the 6th week, five vaccine will be given, and again the repeating on the 10th week, three vaccines will be given, and the 14th week there will be the five vaccine will be given. Till here it is easy to you and you understand this thing. Yeah, doctor, I'm okay, right? I'm okay now. Till here, did you understand till here? Let me know in the chat box. Did you understand? Please remember at the birth, three vaccines will be given. 5th, 6th week, five vaccine will be given. Again, three vaccine. and again 5 vaccines. So please remember 3 5 3 5. Did you understand till here? Should we continue? Should we continue further? Okay, remember this. Okay, what are the vaccines will be given? You have to remember. Now the ninth month. Please remember ninth month. There will be the additional. There will be the additional vaccine will be added. So they can ask you. They can ask you about this additional vaccines, which are they will be added on the added on the your ninth month. So please remember there will be the given MR1, right? The MR1 will be the first dose will be given. So in the PYQ, please remember this is your PYQ that MR1 dose will be given at which age. So please remember at the ninth month we'll give the first dose of the MR1 and the please remember the PCV6 will be given here. There will be the PCV will be given. And what about this? Our fractional IPV we given at the sixth week, we given at the 14th week, and the ninth month the third dose will be given. And the second thing be additional here, your Japanese encephalitis, and marking I'm star here because this is a very important. The Japanese encephalitis will be given only in the endemics area. Please remember, this is the in the national immunization schedule will be given that this will be given to the all the nations. But what is the importance? If there is the endemic of the Japanese encephalitis, then it will be included in the it will be included in your schedule, right? So there will be the this is the not the surely that will be given in the all the times, that will be given in the endemics area, and please remember about the vitamin A dose. There will be the vitamin A dose will be given. I hope in the pediatrics you studied very well. Then before the 1 month we have to give the 1 lakh international unit, right? Before the 9 months we have to give the 1 lakh international unit, and after the 9 months we have to give the 2 lakh international unit, right? Please remember this. So that will be given also at the 9 months. So please remember at the 9 month which new vaccines will be added there. Your MR1 will be added, Japanese encephalitis one will be added, and the vitamin A. Vitamin A will be added here. So this will be important for you. So making Q mark here, the 9 month vaccines you have to remember. You have to remember. Moving forward for the now 16 to 24 month. Now at the 16 to 16 to 24 month, please remember here what will be given. Your MR2 will be going to repeat it here as we given on the 9 month. The first vaccine of the MR, now MR2 will be given, and they will add one more vaccine, that is your DPT booster. Please remember which I mentioned here, B, it is a booster dose. Okay, this is the booster dose, and will give the OPV booster also. Oral polio vaccine booster will be given at the 16 to 24 week. And the Japanese encephalitis too, again I'm highlighting it because that will be given in your endemic area only. Right? So till here you have to remember, and after that there will be the nothing you have to given. Just please remember at the 5 to 6 age there will be the DPT booster will be given, and from the 10 to 16-year-old there will be the TD, right? The tetanus and the diphtheria, the low dose diphtheria will be given in this case, right? There will be the low dose will be given in the diphtheria. Right? So this will be your national immunization schedule. I hope you understand this national immunization schedule till now, right? Just repeat the all the things I'm revising you again, and you have to remember this. Yes, doctor, it will take to 4 to 5 hours. It will be take to 4 to 5 hours, but I'm damn sure that will be beneficial for your upcoming exam, which is after the 2 days only, right? After the 2 days only, right? So what will be your in national immunization schedule? I'm revising you again. At the birth, will given the BCG, OPV, and hepatitis B. The 3 vaccines should be given. After that, on the 6th week, you have to give the Panta 1, Rota 1, OPV 1, fractional IPV 1, and your PCV 1. Right? The next, on the 10th week, you have to give again the 3 vaccines. What are the 3 vaccines? Which are the first I'm written on this 6th week? Just repeat the second dose of that. The Panta 2 will be there, Rota 2 will be there, and OPV 2 will be there. OPV 2 will be there. After that, on the 14th week, we'll repeat the same vaccines which will be given on the 6th week, just in the next doses. So Penta 3, Rota 3, OPV 3 will be given, and your fractional IPV 2 and the PCV 2 will be given. Okay, at the 9 month, please remember about the 9 month. This is a very important. They are asking you about the questions on the 9th month. They will asking you which are the new vaccines will be added there. So the MR1 will be added there, and the PCV6 will be added there, and the JE and vitamin D. So this 3 will be added there. Rather than with this, we have the PCV3 and the fractional IPV 3 dose will be given. On the 16 to 24 months, just remember the same thing, the MR2 DPT will be booster will be given here. So first booster will be given at the age of 16 to 24. Please remember, first boosters will be given, right? So OPV booster and the DPT booster will be given here. The OPV booster and the DPT booster will be given here. And the Japanese encephalitis, the second dose will be given. On the 5th and 6th year, there will be the DPT booster will be given only. And on the 10 to 16 year, there will be the only TD, the tetanus and the diphtheria will be given, right? The important thing which you have to remember for the storage of the vaccine, for the storage of the vaccines, we have to maintain the temperature of the vaccines, right? You know about it, you know very well that we have to maintain this temperatures of the vaccines, and this will be your +2. Please remember, this is the +2 to +8 degree vaccines. So we have to maintain this temperature of all the vaccines to prevent them to storaging form, right? So if you are storing any vaccine, you have to maintain the temperature +2 to +8. So this is known as your cold chain. This is known as your cold chain. Okay, this will be your cold chain, right? What will be the cold chain? We have to maintain. So how we will be maintained? Please understand this. This vaccine will be produced in the industrial area. So जहाँ पर ये process होंगी, जहाँ पर ये बनेंगे, from there, from starting from the there till to the end, till the end, like in the CSC, PSC, and the Anganwadi center, till they will be distributed to the right, or in the hospitals, right? So this will be maintained in, this will be the maintained in the temperature of +2 to +8. This should be maintained into the +2 to +8 degrees Celsius, right? That is your cold chain, right? That is your cold chain. Now we are starting from the open vial policy. This is the important MCQs, and this is your PYQ also. This is your PY2, or you can say the PYT, right? Previous year topic. This is in come into the previous year topics. And what should be the in this open vial vaccine? Please remember, this is a very easy thing, that you understand the vaccines are coming into the vials. Okay, so the vaccines are coming into the vials. Okay, and when you are opening the vials, this is having the doses like 5 doses, 10 doses, 20 doses, different volumes having the vaccine vials. So in this vaccine vial, if you are opening a vaccine vial to give to the any child, right? You're given any child. Okay, so you can understand that when the vaccine will be opened, the vaccine will be opened after the opening of the vaccine, that will be stored till the 28th day of the opening. So as I opened a vaccine today, so I can store this vaccine. I can store this vaccine for the upcoming 28 days, and I can given the doses to the patient. I can given the doses to the child, right? So this will be the in your open vial policy. But but there is some exceptions are there. There is some exceptions are there that are not following this. It means if you keep them stored after the opening, if you are storing it, it will be not stored. It will be not stored. So what are the there? Those are your measles, rota, BCG, COVID, and the Japanese encephalitis. So please remember which are not following the exception, right? What are the exceptions here? Which are the exceptions here which are not following it? So these are your measles, rota, BCG, COVID, and the JE. But if I'm asking you about the applicable, please remember the applicable also. Like which are the applicable? If you open this vial, we can store this vial for the upcoming 28 days. For the upcoming 28 days, which are the applicable in this open vial policies? These are your oral polio vaccine, DPT, DT, your tetanus diphtheria, TT, and hepatitis B. Pentavalent vaccines are also here, and your IPV and the PCV, pneumoconjugated vaccine, right? So this will be the your all the vaccines are having the applicable for the open vial policy. This open vial policy is saying that we can store after the opening of the vial. Please remember, after the opening of the vial. I'm not saying that from the production side to the distribution side that will be your the duration is the 28 days. No, please don't be confused in this. This is after the opening. If you're opening today, if you're opening a vial today, so for upcoming 28 days you can use this vaccine, and which are the non-applicable, you have to remember this. These are the non-applicable, means the exceptions are there the same. So this is about the BCG, MR, MMR, and JE. The rotavirus vaccine, the rota will be here, and the COVID-19 vaccine will be here. The COVID-19 vaccine will be there. Okay, so this is about your open vial policy. This is about your open vial policy. Did you understand the open vial policy till here? Yes, doctor. Yes, doctor. My health is okay. Now I'm okay. No issues. Okay. What about you guys? You all are okay? You all are okay? Okay. So this is about your open vial policy, right? I hope you understand this topic, and this is a very important topic. It can come in your exam, in your upcoming FMG exam. So please remember about the open vial policies, which are applicable and which are not applicable. They can confuse you between it only, right? They can mention you like which all the vaccines are applicable for the open vial policy, except they can mention you the except. So please understand this thing, and you have to answer it, right? So you have to learn by heart this thing, which vaccines are applicable and which are the not applicable. Now I'm moving forward for the next topic. Our next topic is saying the vaccine side effects. So the vaccines are having some side effects also, right? So we have to remember, we have to understand what vaccine is causing which kind of the side effect, which is you have to remember, which you have to remember. So starting with the first one, which is your BCG. Starting with the first one, which is your BCG vaccine. In this BCG vaccine, this will be given at the 1 year. This will be given at the 1 year, and the side effect of a BCG vaccine, please remember, it is causing your lymphangitis, right? So this is causing your lymphangitis, right? So this will be the inflammation in the lymph nodes, right? There will be the lymphangitis, okay? So this will be caused by your vaccine of the BCG vaccine. So it is the side effect. You can say this is the side effect. The next is your hepatitis B. If you're given the hepatitis B, this hepatitis B will be given until the 24 hours. They will be given until the 4 hours. So until the 4 hours, they will be given. This hepatitis B can cause the side effect, and it's prevent. Please remember, this is the prevent the mother child. This will be the preventing the mother to child transmission, right? So this is the side effect. There will be the prevent the mother to child transmission will be given. The next, the OPV, oral polio vaccine. The oral polio vaccine given until the 5 years. We can give until the 5 years of the child, and there will be the VABP. Just remember the this will be your side effect of oral polio. The next and the important, which you have to remember, which is having the highly chances to come in your exam, that they are asking you about the fractional IPV side effect. What is the fractional IPV side effect? That will be given until the 1 year, and the hypersensitivity. Please remember, the hypersensitivity is the side effect of your fractional IPV dose. The IPV. Okay. What about the Panta? The Panta is having the more side effects. If you are talking about the Panta will be until the given as a 1 year, and there will be the neurological. Please remember, there will be the neurological deficit will be asking, and inconsolable. The cry will be there, and seen in the more. The cry will be seen in your pertussis vaccine. The cry will be seen in your more in the pertussis vaccine. The next and the important, which is your PYQ, I'm highlighting it, the rotavirus given until the 1 year, and this is causing your intussusception. This is causing your intussusception. Please remember, this is your PYQ. This is your PYQ. The previously yearly, this question will come there, that intussusception. The intussusception is the side effect of which vaccine? Which vaccine? So you have to remember, this is the side effect of your rotavirus vaccine. This is about your rotavirus vaccine. Okay. The next is your PCV. In the PCV, there is again, it will be given till the 1 year, and the hypersensitive will be there. So you can remember the fractional IPV and the PCV will causing the side effect of hypersensitivity. And if you're talking about the MR will be given till the 5 year of the age, and there will be the seen the measles like rash will be seen, right? So there will be the measles like rash will be seen in this condition, right? So out of this, you have to remember the important ones, the BCG, okay, the FPV, and Panta is also important. The most important, because this is your previous year question, so maybe it can repeat again. They have the chances to repeat again the Rota one, which is the intussusception, right? So you have to remember of this vaccine side effect. You have to remember about this vaccine side effect. Okay. Now we have to talk about the diluters also. Diluents. What is the diluent? So the some vaccines are coming in a dry form, Okay, so we have to dilute with them. Okay, we have to dilute with them. So starting with the BCG vaccine. So the BCG will be diluted into your normal saline. The BCG will be diluted into your normal saline. We have the normal saline, NS will be there, or no? So we'll dilute this BCG vaccine into the normal saline vaccine. Will normal saline. Okay, so we'll dilute the BCG with the normal saline. And if we're talking about the measles vaccine, if we're talking about the measles vaccine, this measles will be the diluted. The measles vaccine will be diluted in your distilled water. This will be in your distilled water, right? And if you're talking about the important one which can ask you about the Japanese encephalitis, JE, will be in your phosphate buffer. Please remember about this phosphate buffer. This is a very important, having the chance to come in your exam, having the chance to come in your exam, right? So this is the JE will be the Japanese encephalitis having the dilutes of your phosphate buffer, right? Hello, doctor. The PDF file, of course, I already informed you that the PDF files of my all the classes will be mentioned. The link of the file will be mentioned in the chat comment box after the session. Just after the session, I will put the link of my this PDF in the comment section. So I will pin the comment. I will try to pin the comment on the top, and you can just click on that link and you will get the file of this session. Okay. Okay, doctor. Right. So, right, the next now, as I already told you, the vaccine, from where the vaccine is the production of the vaccine till the use of the vaccine, we have to maintain the temperature of the vaccine. And what is your temperature? Please remember what is your temperature. In the cold chain, we have the +2 to +8 degrees Celsius. Okay, we have to maintain +2 to +8 degrees Celsius of the temperature of the all the vaccine. So this is known as your cold chain. That is known as your cold chain. So we have to maintain the cold chain, right? We have to maintain the cold chain from the production side till to the use side, right? We have to maintain this all the vaccines into the temperature of +2 to +8 degrees Celsius. Understand? Now, how we can maintain this thing? Please remember. So we have to use the ice line refrigerator. These are known as the ice line refrigerator. So what is this ice line refrigerator? There will be a vaccine. This vaccine will be needed in this ice line refrigerator. Vaccine will be needed to the 8 hours of the electricity. There will be the 8 hours of the electricity in 24 hours. So it means just out of the 24 hours, if the 8 hours the electricity will be there will be the ice will be lying in this refrigerator. It will maintain the temperature. It will maintain the temperature from the +2 to +8 degree temperature, right? And there is the placement of vaccines will be in a manner. There is the placement of vaccine in a manner. So what are the manner? There will be the top of the eye layer. In the top of the eye layer, we have to keep the to keep the all the dilutants and other things will be given on the top. On the top will keep the dilutes and all. Just please remember what are the most heat sensitive. The most heat sensitive, right? The most heat sensitive, which is the reconstructed, which is your reconstructed BCG vaccine, your reconstructed BCG vaccine, OPV, measles and rubella. So these are the mostly heat sensitive. With this, we have the mostly freeze sensitive also. If they will getting freeze, this will be the sense they are the freeze sensitive. And what are the freeze sensitive? Please remember hepatitis B, Panta, PCB, and the DPT, right? So this will be given. And the important thing which can ask you in your exam, this is a rotavirus is following the rotavirus vaccine. Rota will be following the both. Please remember the freeze and the heat sensitive. This is the freeze sensitive also and the heat sensitive also, right? So please remember about the mostly heat sensitive. In the heat sensitive, there will be please remember the reconstructed. Please remember this will be the reconstructed. BCG will be there, OPV, measles, and the rubella. Sorry for it. And about the mostly the freeze sensitive. If I'm talking about the freeze sensitive, there will be hepatitis B, Panta, PCV, and the DPT will be there. And the important thing which you have to remember, I'm making here the question mark. This will be the important question. The rotavirus vaccine is the both. Okay, this is the heat sensitive also and the freeze sensitive also. Now you have to remember, the thing which you have to remember which you have to see. There is a placement, as I already told you. There will be the placement of it. What is the placement of it? So please remember, as the rotavirus is a heat sensitive also. Just now I told you this is the heat sensitive also and freeze sensitive also. So heat sensitive bhi hai, freeze sensitive bhi hai. So it means we have to keep we have to keep in between it. So you can see here we have to put this rotavirus in between it. Okay, so हम इसको कहाँ रखेंगे? Between here in this area. Okay, in this area. Now, which are the heat sensitive? So we have to keep them on the lower side of on the lower side of our ILR. Okay, so it means if there will be the no heat, there will be the more cold temperature will be there, and which are your freeze sensitive, we have to keep them on the top of on the above on the above it, right? So there will be the no loss in the freeze sensitive. So there will be not freeze. So you can see these are the freeze sensitive. These are the freeze sensitive. So we'll put it above side, and these are the heat sensitive will be put into the deep side, and rota will be on the middle side, because the freeze sensitive, this is the freeze sensitive also and the heat sensitive also. So this is the your IRL, ice line refrigerator, ILR, right? And you can see on the other side there will be having the compressor of it. It is having the compressor of it, and these are the ice packs. These are the ice packs which is above it. Okay, these are the ice packs. Then starting with this, please remember, this is the thing which you have to remember, the pattern which how you will be follow, or you are putting this vaccine. So the first thing what will be there, you have to go from the below to above. Okay, because for the putting this vaccine you have to put the OPV first. Okay, सबसे पहले रखोगे तभी वो सबसे नीचे होगा. This is the common thing. So the OPV will be there. So OPV will be put it here. OPV. After the OPV, there will be the measles vaccine, and above the measles we have the BCG, and JE will be put it here. The BCG and the JE will be there. After the BCG and JE, there will be the rota. There will be the rota will be, and after the rota we have the TT, right? Above the TT, we have the DPT and the IPV, and then we have the Penta and the hepatitis B, right? So this will be this will be ओके ओके श्योर श्योर श्योर. हिंदी भी रखेंगे, ठीक है, हिंदी भी रखना है. इट मींस हमें क्या करना है, सबसे पहले जो आइसलैंड रेफ्रिजरेटर उसमें सबसे पहला वैक्सीन कौन सा रखना है. दे कैन आस्क यू व्हिच शुड बी पुट इट फर्स्ट. सो प्लीज डोंट रिमेंबर, नॉट विल बी द हेपेटाइटिस बी. हेपेटाइटिस विल बी ऑन द अबव साइड. Okay, so hepatitis will be on the above side, so we have to put the first the OPV. So OPV will be on the lower side, please remember, because this is the heat sensitive. It is the heat sensitive. After the OPV we have the measles. Right, above the measles we have the BCG and the JE. Rota will be in the middle area. In the middle area you can see there will the rota will be there, and then TT, DPT, IPV, and the Penta and the hepatitis B. On the above side we can give the diluents. Okay, यहाँ पर हम क्या रख सकते हैं, diluents रख सकते हैं. ठीक है, so this will be the important image, and the IP this is the important image. Okay, very important image, right? Okay, so you have to remember how this will be, how the the vaccines will be kept in your ILR. This, what is this? This is your dial thermometer. Okay, this is your dial thermometer. What is this dial thermometer? This dial thermometer will be put it in your ILR. This will be put it in your ILR to get the temperature of this ILR, that what the temperature will be maintained here. And you can see this is showing from the -30 to the +60 temperature. This is showing you the -30 to the +30. And as I already told you, what is our temperature we have to maintain in the cold chain, that will be your +2. It will be here from the +2 to the +8. So please remember, this should be always in this area. This should be in your always in this area, in the cold chain temperature, in the cold chain temperature, right? So this is the dial thermometer which will put it into your put it into your ILR, and we are getting the temperature from it, right? Although there is a nowadays this is the compressor, and there is a digital screen should be given which is showing you the temperature, which is showing you the temperature of the inner line of the ILR, right? So जो internally temperature है वो हमें कैसे पता पड़ता है? From the digitally also we can get, and this dial thermometer will be also used. This will be put into this ILR. Okay, so this is all about the cold chain. This is all about the cold chain. Now you have to understand the next thing, which is your VBM. This is your vaccine vial monitor. This is your vaccine vial monitor. And what is this vaccine vial monitor? Please remember, this vaccine, which vaccines can be kept till 28 days, right? As I already told you, right? So this VVM is on the vial body. The VVM, this VVM, please remember, this is your VVM, vaccine vial monitor. This will be on the body of on the body of the vial. And vaccines which do not come under the open vial policy, please remember, which is not coming to your open vial policy, the VVM is on the neck or the cap of the vial. Understand? So जो vaccines, which vaccines are following the open vial policy, उसमें कहाँ होगा? That will be on your body. So you can see this is the body, right? This is the body of the vial, so it will be put it on the vial of the body. And which vaccines are not coming into your which is not under your open vial policy, there will be on the neck or on the cap of the vial will be put it there. And what is the importance? Please remember, this is the very important thing, and this is your PYT. This is your PYT, and this image is your PYQ. Previous yearly topic hai ye, and the previous year image question will be there. This is your PYQ will be there. Image was there. And please remember, what is the use of this vaccine vial monitor? This will be going to tell you about the heat exposure of the vaccine, right? As I already told you, we have to keep the vaccines into the cold chain. हमें vaccines को किसमें रखना है? Cold chain के अंदर रखना है. But in case there will be this heat exposure, if there will be the heat exposure at the any level, maybe from the production side, starting from the production till to the given to the site, okay, which is the distribution side. In this cold chain, maybe there will be the heat exposure of the vaccine will be happened, okay, by mistakenly, and this will be the now this vaccine will be destroyed. So how will you get to know? So this will be indicating you the efficiency of the cold chain, right? So this vaccine vial monitor will give us the efficacy. This will be the give the us the efficacy of the cold chain. So what about this cold chain? If it is maintained in the cold chain, or it will be heat, it will be the exposed to the heat, right? So for getting it, we have what will be there will be the color change in the inner square. So there will be the thing will be there. So now you have to understand what is the VVM. I hope you understand the VVM. This will be given in the open vial policy, with which vaccines are following the open vial policy, that will be on your body of the vaccines, right? Body of the vial. And which are not following the open vial policy, OVP, and that will be in your that will be on the neck or the cap of the vaccine. And it is showing you the heat exposure. It is showing you the heat exposure. There will be the maybe there will be the any heat exposure will be there, that is showing you the heat exposure. So now we'll get to the heat exposure. Please remember, there will be the a circle will be drawn of this VBM. You can see here this circle will be drawn of the VBM. And in this circle, we have inner side a square will be there. You can see this square. I think it is clearly visible to you. This square will be here. And you can understand, you can see here, this is the dark side. The outer circle is the dark color, which is the dark blue color. And the inner square is a light blue color. Okay, this is having the light colors. So now, sorry, now this is the normal vaccine. Okay, this is the normal vaccine. If it is getting heat exposed, so what will be happen? This is the first vaccine, this is the second vaccine. Please remember, what will be the second vaccine? You can see here, this the light color will be getting dark. This is square is changing the color and getting little bit dark. But please remember, this is lighter than the outer circle. This is the lighter than the outer circle. You can see on the second vaccine. Please check clearly this image. If you want, I can zoom on it. I think now it's clearly visible to you guys, right? Now it's clearly visible to you guys, right? So you can see this first one. I'm revising you again. This first one, we have the one outer circle will be there, which is the dark color, and we have one inner square will be there. We are having the one inner square will be there. and this square is lighter than, this is lighter than the outer circle. Yes or no? Yes. And this is the normal vaccine. This is the normal vaccine. On the second vaccine, you can see this is changing the color. This square is getting little bit darker, but it is lighter than the outer circle color. So जो बाहर वाला circle वाला color है उससे ये क्या होगा, डार्क होगा, लिटिल बिट डार्क होगा. जो प्रीवियस वन फर्स्ट वैक्सीन है उससे सेकंड वैक्सीन डार्कर है, द स्क्वायर इज गेटिंग डार्क, बट इट विल बी नॉट डार्कर देन द आउटर सर्किल. सो यू कैन सी दिस आउटर सर्किल इज मोर डार्कर एंड दिस स्क्वायर इज a little bit lighter side on this. The third one, the third vaccine will be here. Now you can see on the third vaccine it is getting similar to it, it is getting similar to it. We cannot differentiate it, we cannot differentiate it in the third vaccine. And the fourth vaccine, this will be your fourth vaccine. On the fourth vaccine, you can see the square is getting, this inner square is getting more darker, the square is getting more darker. So now this is showing us, about the, this is showing us about the heat sensitive. Now it's shown by the heat sensitive. So now we have to compare, the outer circle and the, we have to we have to see the inner square color. So the thing is here, which vaccine should be used after the seeing this VVM and which should be discarded? Now the question is here. So please remember, discard the point, the same color will be getting started. So it means the 1 and 2, this vaccine 1 and 2 will be used. Okay, we can use this vaccine, we can use this first and second vaccine. Please remember the second, third and the fourth vaccine, this third and the third and fourth vaccine should be discarded. Okay, this vaccine should be discarded, this vaccine should be discarded. Okay, now you understand. This VVM shows us, this VVM will be showing us the exposure of the heat exposure to the vaccine, the heat exposure of the vaccine that will be shown by this, right? And we have to see, we have to compare the outer circle and the inner square circle, the square color match, we have to match the color. Please remember, the outer circle will be darker always, the outer circle will be darker always, and the inner square will be lighter than it. But if this color will be getting changed and it will be getting similar, the square is getting similar to the circle, or this square is getting darker than the circle, we have to discard, we have to discard this vaccine. I hope now you understand this. Now, I hope you understand this, and please remember, this PYQ will be asked you with this image also, that which vaccine should be used and which vaccine should be discarded. So now you have to remember, that the vaccine 1 and vaccine 2 will be used, because there will be the this square with the inner square that is having the lighter color, having the light color inside, and the third and the fourth vaccine having, the third is having the same color, the as the circle is having, and the fourth one is having, the darker square inside, right? So that should be the discarded. So the third and the fourth vaccine should be discarded as per the VPM. Did you understand? Did you understand? Should we move forward? Should we move forward? Very good. So now we have the three things which can maintain our cold chain. This is your ice pack, and this will be your day carrier. This will be your vaccine carrier. Again, the same thing. You have to maintain all the cold chain. You have to maintain the we have to maintain the cold chain. So for maintaining the cold chain, this is the smaller side of the cold chain. We have the in on the CACPSC, we are having the ILR, deep freeze on the district hospitals, and the cold room, walking cold rooms on the state levels, right, on the national levels, right? But these are the smaller side, and you can see this is the ice pack which is having the two space here, so we can put it, the two vaccines should be put it here, right? So this is having the capacity to maintain the two vaccines in it. We can put the two vaccines here, rather than you can say in the day care daycare you can put 4 to 8 vaccines. 4 to 8 vaccines should be put in here. And please remember, in this day care box, you can see there will be two ice packs should be on the both side. There will be two ice packs should be put in here, and we can put the 4 to 8 vaccine. We can keep store this 4 to 8 vaccine in this day carrier, rather than in the vaccine carrier. In the vaccine carrier, there will be the four ice pack will be there. There will the four ice pack will be there, and 16 to 20. Please remember, the 16 to 20 is the vaccine. We can put the vaccine in this vaccine carrier. So these are the three things which you have to see on the distribution level, because in the distribution level you have to take this vaccines from the deep freeze or the ILR, and you have to carry this to the distribution site. So for carrying this you have to maintain the cold chain also. These are the minimal site of the cold chain, right? हम कहाँ तक cold chain को maintain करना है, तो यहाँ तक हमें cold chain को maintain करना होगा till the distribution. So we can maintain with the ice packs. So in the ice pack you can see there's a two space is maintained, so we can put the two vaccines in it. Okay, so we can carry with this ice pack the two vaccines. We have the day carrier, there's the box will be there, and we'll put the two. Please remember the two ice packs will be put in here, and this two ice packs will be getting on the both side, and there will be the 4 to 8 vaccines should be carried in this. 4 to 8 vaccines will be carried. The next we have the vaccine carrier will be there. In this vaccine carrier we having the 4 ice packs will be there on the fourth side. चारों तरफ क्या होगा, ice packs होंगे. The 4 ice packs will be there, and we can carry the 16 to 20 vaccines in it. Right? So I hope you understand this. Now I'm moving forward for the important thing, which is your level of prevention. Which is your level of prevention. What is the prevention, guys? Let me know in the chat box. I'm waiting for you. What do you mean understand by this mean of the prevention? Mean of this prevention. Level of the prevention. So we can prevent the diseases at the different levels. So what will be the levels as per the PSM? This is the PYT. This is your PYT. Please remember, this is your previous year topic. Okay, and this is having the surety to come one or fix one MCQ from this topic. This is the surety. So please understand this topic. I will try to explain you this topic in a very easy manner, and this is a very easy topic. If you understand this, this will be the very good. Okay, and you will secure your 1 marks. Starting with the first one, the prevention. You can understand the what is the mean of the prevention. So preventing the disease. Okay, prevention is the prevent diseases. Okay, so हमें क्या करना है, prevent करना है disease से. Starting with the first one, this is the 4 level will be there. The four, what is the 4 level of the prevention? The first will be the primordial, the second will be your primary, third will be your secondary, and the fourth will be your tertiary. Please remember, there will be the 4 levels will be there of the prevention. So first will be your primordial, second will be your primary, third will be your secondary, and the fourth will be your tertiary. Just I'm starting with the first one, which is your primordial. Just remember this, there will be the avoiding the risk factor from the emerging. What is this saying? This is saying that we are avoiding the risk factor. We are avoiding the risk factor from the emerging. So there the maybe the risk factor can be emerged in the later part. So before the emerging the risk factor, we are informing the patient to avoid it. Now what is this, what is this example? If I'm talking about the example, this is your health education. This is your health education. That will be your health promotion, lifestyle modification. So what do you mean understand by this? I can give you the one example only. You can see on the tobacco containing things like the cigarettes or this chewing tobacco packets, there will be a information will be given that using of this tobacco can cause you the lungs cancer, right, and the oral cancers, right? So this is your health education or the health promotion, that we are awareing the patients that if you are using this, it can emerge you a risk factor of it, right? It can emerge you a risk factor. So telling about this, maybe the next thing for the telling in the adolescent age, we are going to the schools, right? We are going to, doctors are going to school and giving the information about the STDs to the students, right? We are giving the information related to the STDs to the information, and giving this education, the health education and the health promotion is coming into your primordial. This is coming into your primordial level of the prevention. So in the primordial, maybe the advertisement, like you can see in the advertisement, there is advertisement related to your chewing tobacco or smoking cigarettes. There is a Mukesh, right? The every time you are going to the cinemas, there is a banner will be starting in the health education that the Mukesh was using the smoking, and now he's having the oral cancer, and this is cut it out, right? So what is this? This ads and other things, and this promotions are, these are the health promotion and the health education. So these are coming into your primordial. Please remember, this is the primordial. So all type of the health educations, health promotions, or maybe the life modification, like the one patient is the obese, the one female is very obese, so you can give the lifestyle modification to that. Maybe in the later part the female we can get the the PCOD, right? PCOD. Or maybe the obese person is there, we can getting the risk factor of the diabetes mellitus, right? So these all the things are coming into your primordial. This is understandable for you? The primordial is understandable for you? समझ आ गया primordial? Okay, this will be about your primordial. Now I'm going for the next is your primary one. What is the primary one? Please remember, there we are avoiding the disease from the emerging. What was the done in the primordial? In the primordial, we are avoiding the risk factor emerging, right? If you smoke the cigarette, there will be the risk factor of the cancer will be emerging, can emerge. So we was, what we was doing, we was doing the primordial stage. At the primordial stage, we was doing avoiding the risk factor emerging. But in the primary stage, please understand, in the primary stage, what we are doing, we are avoiding the disease from the emerging. We are avoiding the disease from emerging. What are the examples? Please understand. What are the example? The first one is your specific protection, which are in your vaccines. Just before this topic, we talked about the vaccines, and you can understand what are the vaccines. Please remember, these vaccines are coming into your specific protection. These are coming into your specific protection. What do you mean understand by the specific protection? As I already told you, the we given the OPV vaccine. So this, what is done by this OPV vaccine? This OPV vaccine will avoid the polio disease from the emerging. Yes or no? Let me know in the chat box. Yes or no? So it means we are giving a specific protection. What we are giving? We are giving a specific protection. We given a specific vaccine, and it is protecting us from the specific disease. This is protecting us from the specific disease that is coming in your primary factor. The next is your chemoprophylaxis. This is your chemoprophylaxis is also coming into your primary vaccine. The all type of the vaccines are here, and the pre-exposure and the post-exposure are also coming into your primary prevention only. The re-exposure of the rabies and the prophylaxis is coming in that. Now you guys can ask me, sir, pre-exposure, post-exposure, and the re-exposure of the rabies. If it means, if the dog bite will be there, right? In the dog bite, when the patient is coming to you, the dog bite will be there. So it means there is a risk factor is available. Please remember about the primary. For understanding the primary, you have to remember the one word. There is a risk factor present. यहाँ पर risk factor present. If I'm talking about here also the risk factor in the primordial, but risk factor is absent here. Just we are giving the information. If you are smoking the cigarette, there will be the cancer can be occur. The risk factor, the cancer will be can be caused there. But please remember, in the primary one, there is a risk factor is present. There is a risk factor is present. It means there will be a dog bite will be seen. There will be one dog bite will be seen. The patient is coming to you with a dog bite, and you can understand now that there is a risk factor is present, that it can be, there will be, can be caused in the future. There will be the rabies can be there. Rabies can be, it means the risk factor is presented there, and we are giving the rabies vaccine to the patient. That will be your primary, that will be your primary treatment, right? So for the disease, chemoprophylaxis. What is the chemoprophylaxis? We are doing in a group of the, or the bunch of the patients, we are trying to making the diagnosis of it. The disease is chemoprophylaxis, right? We are making the chemoprophylaxis, as in the TB, leprosy, HIV, and the malaria, right? Hand washing after the touching the patient. Please remember, they can ask you, this was a one question was asked you, the hand washing after the touching the patient, what kind of prevention? What kind of prevention? Please remember, this is also, there will be a risk factor. Okay, so the risk factor will be present there, yes or no? If you are touching a patient and you are touching to the next patient, right? You are taking around in the wards. If you are touching, right? If you are touching, in the patients, you are touching a one patient from the, and on the second you are touching to the second patient, maybe you can transmit it, the any touching infection, right, contaminated infection, you can transfer it. So this is the risk factor. Just please remember, doctor, no, there will be the disease will be not there. Please remember, risk factor bhi nahi hoga in the primordial, and disease will be also not there. Please remember, yeah, disease will be also not present in your both of it. Okay, disease bhi nahi hogi. Not disease will be in the primordial, no disease will be in the primary also. Primary will be no disease. Okay, no disease will be in the primary also. Okay, primordial में भी कोई disease नहीं है. Primordial, what is the primordial? No risk factor, no disease. Just we are giving the education to the patients. If you do this, there will be the, it can cause this. Okay, but in the primary there is a risk factor should be present, there will be the risk factor should be presented there, but disease, till now there will be the no disease वहां पर नहीं है. Okay, disease वहां पर नहीं है. It means, just I already told you, it means one patient is coming to your clinic with the dog bite, right? Dog bite वहां पर है. It means the risk factor is presented that it can get the rabies. But क्या rabies disease उसको हो गई है क्या? No, there is a no rabies disease. Just after the bite there is a no rabies, है ना? Rabies तो हुआ नहीं ना उसको. We can prevent it. So the risk factor is presented there, but the disease is not there. The disease is not emerged till here. Okay, did you understand till this primary also? I hope you understand till here. Now we are moving forward for the next is about the secondary. So हमने बात करी थी हमने बात करी primordial की, there will be a risk factor, no, disease will be no. In a primary there was a risk factor present and the disease was the present. Disease was absent in the primary, but here if I'm talking about it, the secondary, please remember about the secondary, the disease will be present here. Now in the secondary there will be the disease will be present. And as the disease will be present in the secondary, so now what we are doing, we are avoiding the complications due to the diseases. As the disease is already present, now you said just now only, sir, disease to yahan par hoga hi hoga. So if disease is there, so now what we have to do, we have to avoid the secondary prevention, we have to avoid the complication. Okay, so for the avoiding the complication, we have to do the early diagnosis of the disease and the early treatment of the diseases. ठीक है, जितना जल्दी हम डायग्नोस कर लेंगे डिजीज को, जितना जल्दी हम ट्रीटमेंट करेंगे डिजीज का, there will be the less complication. So in the secondary type of the prevention, we have to do the early diagnosis. You have to remember this thing. We have to make the early diagnosis and the early treatment. So there will be the disease will be in the control and there will be the no complications. The complications will be not seen in these cases, right? So we have to preventing from the complications, right? We are avoiding the complication, like we are giving the MTD to the leprosy patient, right? So multi-drug treatment will be given to the leprosy patient, right? ACT will be given to the malaria patient. ART will be given to the HIV patient. ATT should be given to the TB patient. So as in the TB patient is coming to you, you're given the ATT, anti-tuberculosis treatment will be given. As given the ATT, now what you did giving the ATT, you diagnose the patient and you treating now the patient. You are treating now the patient. So now when you are treating this patient, there will be the treatment and the diagnosis is coming into your secondary level of the prevention, in the secondary level. And when you are giving the early stage, in the early stage you are giving the ATT, there will be the less complications will be seen. So that's why we have to do in the secondary level of the prevention. We are avoiding what we are avoiding the just complications will be avoided, right? And advise the physical exercises. Please remember the advice for the physical exercises to the patient of the CAD or the diabetes is also coming in our secondary level, because the disease is present there. Please remember the CAD and the diabetes is already presented there. After the disease you are advising that is coming in your secondary prevention. Okay, if there is a risk factor, please remember of it, there is a risk factor of the obesity is there, the patient is having the obesity and you are advising it, please do the exercise. Please understand this thing कि patient obese there and you are advising the patient, please exercise करो, physical exercise करो, otherwise there will be the development of the diabetes mellitus can be occur. अभी तक diabetes mellitus हुई नहीं है, please understand this, only risk factor वहाँ पे available है. If risk factor available है, disease हुई नहीं है, it means this is, and you are advising to the exercises, that is your primary level prevention, yes or no, that is your primary level prevention. And this, in the secondary, please understand, one patient is coming to you who is having already diagnosed with the diabetes mellitus, it means the disease is presented there, what disease present है, and now you are advising to controlling your glycemic control. To controlling your glycemic control, you have to do the physical exercise, you have to do the physical exercise. And when you are advising to this physical exercise, the patient who is already having the diabetes, this is coming into your secondary level prevention, that is coming into your secondary level prevention. So please understand, if risk factor present है, disease नहीं हुआ है अभी तक, disease is not there, if disease is not there, you have to mark, the primary, you have to mark the primary. If disease is there and you are advising, or you are treating the patient, or you are diagnosing the patient, please mark the secondary, please mark the secondary. Okay, and now we are moving further for the tertiary prevention. What is your tertiary prevention? Your tertiary prevention is saying that, the tertiary prevention is saying that giving the prostate, the disease is already there, after the diseases, now there is a disability is also there, so avoiding the disability or the death. This is saying the disease is already there. You diagnosed it, you treated it, but that disease is caused a disability. So we have to avoiding this disabilities, or the avoiding the death. We have to do we have to do the things that will be near tertiary, like giving the prosthetic or the amputations or the artificial limb. Maybe one patient has had the amputation, gangrene was there, and you amputated the leg. After the amputation, you given an artificial limb to it. Okay, so what is this artificial limb is doing? This artificial limb is doing the avoiding this disability of the patient, right? Avoiding the disability of the patient. So avoiding this disability of the patient, this will be in the tertiary. Like I'm giving you the simple example. The patient is having the myopia. The patient is having the myopia, and in the myopia you diagnosed it, right? But there will be the treatment. In the treatment part, what you can give the glasses and other things, but please remember, this is the disability of the patient. If he is not using the glasses, he cannot read the what is the written on the blackboard or the other things, right? So there will be the disturbance in the vision, so you given the specs. Please remember that this is a very good example. If you are giving the myopic patient, there will be given the specs. So this specs will be avoiding the disability of the patient. After the wearing this specs, he can easily read all the things, right? So using the specs, or the giving the prescribing the specs, or the giving the specs to the patient of the myopia patient, is coming into your tertiary level of the prevention. Please remember, this will be on your tertiary level of the prevention. So in the tertiary level prevention, the example, there will be the rehabilitation, disability limitation. You limited the disability, yes or no, right? There was a vision disturbance, you given the specs, and you did the disability limitations. So this is coming into your tertiary level prevention. This is coming to your tertiary level prevention. The transplants and the surgeries also. The transplant, maybe the patient is having the kidney failure, right? The patient is having the kidney failure, and you have to do the kidney transplant. You have to do the kidney transplant. So what you are doing, you are avoiding the disability of the patient, or you are avoiding from the death the patient. So this is coming into your, and all type of the surgeries also, right? When we are doing the surgeries and the complication, right? So after the complication, then we have to do the surgery. From the surgery, we are avoiding the disability of the patient, avoiding the disability of the patient. That is, so all the type of the surgery is coming in your tertiary prevention. I hope now you understand all the types, all the various type of the level of the prevention: primordial, primary, secondary, and the tertiary. Just I'm revising it, please listen this part carefully. In the primordial, there will be the no risk factor, there will be the no disease. Just what we are doing, we are awareing the patients, we are giving the awareness. So the awareness will be given in your primordial. Please remember, the primordial, what will be, you are giving the awareness. Like I already told you, just you can see what the awareness we given on the cigarette packets, on the tobacco packets. There is a mention that using of the tobacco, smoking of the tobacco can cause you the oral cancer or the lungs cancer, right? So this is mentioned there. If they mentioned there, this is giving the awareness to the patient. It is giving the awareness. It not mean the patient who is started the smoking, he is having the risk factor, or he is having the disease. No, he is not having, right? It can be, right? It can be will be there. Okay, so this can cause it. So there will be the awareness is coming, the health education, the health promotion, and the all type of the awareness are coming into your prime module. All are coming into your prime module. Now the next thing in the primary, what will be happening in the primary, there will be the risk factor is present, there will be the risk factor is present, but the disease is not there. Please understand, the disease is not there. I given you the very good example, the patient is obese. Okay, so in the diabetes mellitus, the risk factor is obesity, yes or no? In the diabetes mellitus, obesity is a very big having a big role and having a big risk factor of it. So the patient is having the risk factor of the obesity, so you are advising it to do the physical exercises, or otherwise you will develop in the later part, you will develop the diabetes mellitus. Still now यहाँ पर yeah, please remember the primary में disease नहीं होगा, only risk factor is there, right? I given you the example of the diabetes, I given you the example of the dog bite also. The patient is coming to you with the dog bite. Okay, it not mean the patient is having the disease of rabies disease है क्या उसको, no, but it is having a risk factor that patient can get the rabies disease, can get the rabies disease. So what we did in this, we given the rabies vaccine to the patient. So we given the rabies vaccine because the risk factor वहां पे present था, disease अभी हुआ नहीं है, and we are preventing it. So we are preventing the risk factor तो यहाँ पर present होगा, it can cause the disease, so we are preventing this risk factor cannot change into the disease, it is in your primary. The next is your secondary. In the secondary, there is a disease is present. Please understand, यहाँ पर disease present है. If disease is there, now what we have to do? We have to avoid the complications, because complication is also not a good thing. So we have to avoid the complications. So in the secondary level of prevention, please remember early diagnosis and the early treatment is the your main things which you have to do. This is the main thing which you have to do in the early diagnosis and the early treatment. Okay, in the secondary case, the tertiary, please remember, in the tertiary you are avoiding the disabilities, you are avoiding the disability or the death, and that is coming into your tertiary level of the prevention. Let me know in the chat box, guys, did you understand this level of the prevention? Please remember, this is your previous year topic, and about your pyq is your secondary level of prevention is asked, the primary is also asked, and your tertiary is also asked. So in this previous 4 to 5 years, this always and always the level of prevention was asked. This topic is always and always coming in your FMG exam. So my advice to you, please understand this topic very well, right? Understand this topic very well and secure your 1 mark. Secure your 1 mark from this slide. Let me know in the chat box, did you understand or having any query related to this topic? Let me know in the chat box. I will try to clear you. I will try to clear you. Okay. Should we move forward? Okay, very good. You all understand? Very good. Now, the next thing, we are starting with the disaster management. Now we are moving forward and we are starting. The next topic is your disaster management. And in this disaster management, please understand this thing. This is the most earliest phase. This is the most important phase and the early response. What is the early response? As the disaster happened, within the hour, right? Less than the hours, we have to manage it, right? And this managed by, please remember, this is should be managed by your NDRF. What is your NDRF? The National Disaster Response Force. That will be your National Disaster Response Force, and that should is in the under of Home Ministry. This is coming into the Ministry of Home Affairs. Please remember this thing, that your NDRF is coming into the under which ministry? This is coming into your Home Affairs. This is coming into your Home Affairs Ministry, and there will be the disaster migration will be there. So what will be the disaster migration will be there? There will be the planning and the legal measures should be there in this disaster migration. Legal measures should be taken there, and there will be the community safe will be there, and there will be decreasing the impact of the disorder. We are making before the disaster only, we are making the planning of it to make it the safe, to make the community safe, like to making the community safe. So before the disaster only, right, before the disaster only, we are doing whatever things we are doing that are coming into your disaster migration, okay. The next thing we are having, The next thing we are having the disaster preparedness. And there, what is this? This is saying that the gathering the resource may be required during the disaster. So it means maybe there will be the flood will be there. So we need to provide the we need to provide the foods to uh, the affected communities. We have to maybe take out these communities to the safe area. We need the choppers, right? So all the things preparedness. It means whatever the thing or the whatever the source will be needed in the during the disaster, we have to it. Okay, so please remember this. Okay, please remember this. Now if I'm talking about the things that we have to maintain, so you understand now, this is the disaster is coming into NDRF. Please remember the NDRF coming into your home ministry affairs, ministry of home affairs. And the migration, we have the legal measures. हमें पहले before the disaster we have to take the measures or the safeties will be there, or informing the patient, informing the communities where will the disaster can be happen. Is this all are coming into the disaster mitigation. And the next is your preparedness. The disaster preparedness is your gathering the source. All the source should be available for that which is required in the disaster. Okay, the thing, the some important this is about the disaster management, and some important one liners is there, guys. Important one liners is there, I'm covering here. This is the important one liners. And what are these important one liners? The thing out of this, there will be the important things. The most common vitamin deficiency will be seen. This is your vitamin A deficiency. Please remember, the most common vitamin deficiency will be seen. This is your vitamin A deficiency. They can ask you the most common disease after the post disaster. It means after the any kind of the disaster will be there. After the post disaster, there will be the disease will be seen, which is your diarrhea. Please remember, the gastroenteritis or the diarrhea will be there, right? So diarrhea or the gastroenteritis. If you're talking about the most common long-term sequel, there will be the malnutrition. That will be your malnutrition, right? And the most common zoonotic disease after the flood. Please remember, zoonotic disease after the floods. Please remember. Okay. So what is the most common zoonotic disease after flood? That is your leptospira. That is your leptospira. Okay, that is your leptospira. And what is the important thing? Please remember, the vaccines are, please remember, the vaccine should be not given to the all the disaster. At the disaster is started, you can give not the communities. Your vaccine should be given for the health workers and the disasters, right? So we can give this vaccines to be given. If the vaccine is available to related to the diseases, we can give like to the COVID. In the COVID, we given the all the health vaccine will be given to the health workers and the disaster also. And please remember, there will be the no vaccine required for the mass population. We cannot give the, there will the no vaccine will be required for the mass population, right? So this is all about the disaster management. The important thing, there will be the disaster triad will be also there. The triage will be also there. This is a very important triad. This is the very important slide, and this is also your PYT. This is also your previous year topic. And in this in this previous year topic, in this previous year topic, you have to understand that this is, there will be the four categories will be there. The first category will be your red, the second will be yellow, third will be green, and the fourth will be your black. This will be your fourth will be the black. And and please understand this, what is the mean of this will be shown in this categories, that starting with the first one, the red is showing the red is showing the emergent. What is the mean of emergent? That the patient should be needed the medical attention, or it means it should be treated immediately. So we need the emergent. Please remember this slide. The acuity, it means the emergent, and we have to need the treatment immediately. Because if we not treat the patient, there will be the, this will be the threatening to the life, limb, or the organ. So in the disaster triage, please remember, on the triage of the disaster, the first thing, the first thing, they are the, we have the four categories. The first is your red categories. This patient is need the emergent or the emergency will be there, and that need the medical attention as soon as possible. That need the medical attention as soon as possible, and that should be given the treatment immediately. The treatment should be given the immediately. If we are not giving the immediately treatment, that will be life threatening for the patient, or there will be the loss of limb or the organ will be seen there. The next is your yellow category, and this yellow category is your urgent. The yellow category is your urgent. What mean by the urgent? We can get the delay in the treatment, no issues, like 4 to 5 hours or the 7 hours or the 8 hours will be the need. There is a no need of the emergency, like emergency conditioning in this yellow triage. In the yellow category, there will be the triage color in the yellow color. We can keep the patient from 5 to 7 hours, right? There will be the significant injuries will be seen in the patient, and illness can be there, but this is not need the emergency treatment. We can keep the in the delay. Okay, हम उसको delay कर सकते हैं, no issues है ना, with the with the care. The next is your green, which is the least emergency. Least emergency, it means that there is the non-emergent. इसमें कोई emergency नहीं green में. And this is the minimal or the non-urgent. Minimal or the non-urgent, because the patient can be safe and he can wait for the treatment. And I'm giving you the example. Maybe there is an earthquake will be there. As a disaster, I'm giving you the earthquake will be there, and in the earthquake, one patient is having the severely injured in the head and there, and there will the SDH will be there, and subdural hemorrhage will be there, and it just need the emergency surgery or the emergency care of it, right? So this SDH patient, right, or the brain hematoma will be there, right? So these patients are the need the emergency care, that is coming into a red patch. The other side, there is some yellow kind of yellow level of the patient which is having maybe they are having of the fractures of the limb, they are having the serious fractures of the limb, or maybe some wounds are all presented there, but we can delay this patient because there will be only fracture will be there, right? There is a no complication will be there, not emergency will be there. We can treat this patient in upcoming 4 to 5 hours. In the upcoming 4 to 5 hours, no need of this thing. So then it is not the emergent, but this is the urgent thing, but we can keep it in. The next green one, please remember the green one, this is the non-urgent. It means in this that disaster, in that earthquake, just the patient is having some small wounds will be there and the illness will be there, but there is a no emergency to get this treatment, right? So they can be the safe or they can wait for the treatment. And please remember the black one. The black one is the dead bodies. The black one is the expired or the expected to the expire, right? There will be no need of the treatment, so we'll keep this patient into the, if the resources are available, we will keep the confirmed care of it, right? So we can consider the transport or the care of this expired patient after the initial reds are the will be cleared, and it should be may can be delayed. It can be get it does not delay the care of the yellow. So we'll start with the red. The first should be immediately response to the hospital will be your red color from the disaster area, जहाँ पर disaster हुआ है वहां से हम लोग को hospitalize करना है patient को. So first will carry in the ambulance red one, then yellow one, then green one, and the fourth one is the black one. Okay, so that should be tried. But please remember, in the condition of war on in the bad states, this will be the followed the reverse triage. We will follow the reverse triage. In this condition, we'll follow the reverse triage. Understand? So this is about the disaster triage. This is about your disaster triage. Now I'm moving forward for the next important topic, which is your demographic and health. We are starting with the demography and the health. What do you mean understand by the guys demography? Please understand, in the demography is the two word we having. The first word is the demo, then we have the graphy. So demo, it means the peoples. The demo is giving us the mean of the peoples, and the graphy, it means we are studying. So it means we are studying of human population. We are studying in this case we are studying going to studying about the human population. We are going to study about the human population, and there is a 5 demographic processes. There is a 5 demographic processes will be there. Please remember this all the type of 5 demographic process. The first one is your fertility. The childbirth should be the childbirth should be in this processes, 5 demographic processes we have to study in the human population. So we have to see the fertility, the childbirth should be. The second is the demographic process is your marriage. The marriage should be registered and should be in the in the records, right? So we can see the childbirth should be recorded, marriage should be recorded, and the mortality also, the deaths. Okay, birth, childbirth, death, and the marriages. This will be the next, the two more, which is your migration. Maybe you migrated from the one country to the other country, or the social mobility, or the social mobility. These are the important five. These are the important five demographic process. Please remember, they can ask you what are the five demographic process. So please remember the childbirth, which is your fertility, a marriage, mortality, which is your death. The fourth is your migration, and the fifth is your socially mobility. So these are the five factors. So we are starting with the first one. You have to remember we are starting with the crude birth rate. We are starting with the first one, which is your crude birth rate. What is this by your crude birth rate? Please remember the crude birth rate is equal to the total number of the births, total number of the births, है ना, जितने भी total number of the births हुए हैं, and that should be divided into the total mid-year population. This will be your total mid-year population, and that should be your multiplied by the 1,000. That should be your multiplied should be by your 1,000. That will be your crude birth rate. As I already given you the all the five factors important, so we have to go with the all the five factors. So starting with the crude birth rate, what is your crude birth rate, guys? The total number of the births should be divided with the mid-year population, and that should be multiplied into the 1,000. Okay, so please remember about this formulas also. They can ask you about the what is the formula of the crude birth rate, how you are counting, or what is the what is the formula of the CBR, right? What is the crude birth rate? Okay, so the crude birth rate is your total number of the births divided into the mid-year population multiplied by 1,000, right? The next is your important thing, which is your crude death rate. CDR is your crude death rate. And in this, remember, in the crude death rate also, the number of the total deaths will be divided into the total mid-year population multiplied by the 1,000. The same there in the birth, the crude birth rate will be the births will be in the above, and here will be the deaths will be just there will be the changes of it. Please remember, India is the currently in the stage 3. If they're asking you about India, where will be the India? The India is in the demographic, the stage 3, right? Stage 3. What will be here? What will be in the stage 3? There will be the both birth and death rate are declining in every year. Please remember this line, that in what is seen in the stage 3, the both birth and the death rate are declining in the every year. If you are seeing in any country, there will be the both birth rate and the death rate both are declining in this area in the every year we are analyzing all the data from the every year, and it is declining. The that will be continuing in your stage 3. So please remember, if they're asking you, I'm making here a question, right? Question mark, that India in which demographic state, there will be your that will be in your stage 3. That will be in your stage 3. The next is your demographic transition. They are asking about the demographic transition. What is the demographic transition from the high birth or death rate, from the high birth or the death rate directly to the low birth and low death rate? That is your demographic transition. So we are transiting, the transmission will be there, the transition will be there from the high birth rate, high death rate. It is transiting to your low birth rate and the low death rate. So that is your demographic transition. Please remember, the India is in your stage 3. India is in your stage 3. The next is your GFR. What is your, this is a GFR. Please remember, the GFR is the total number of child a female will bearing during her reproductive years. So this is the GFR, gross fertility rate, and this is about your the total number, how much the total number of the female one a child, number of the child. This is the number of the child which the female can bear during the reproduction year. Right, in the reproduction year, this is your GFR. The next is we are having the TFR. We are having the TFR, total fertility rate. What is the total fertility rate is saying? There is the number of the children the female will bearing during the reproductive years, assuming the current age and the specific fertility rates, that will be incoming to your TFR, total fertility rate, right? And please remember about the GRR. The GRR, please remember, in this GRR, there we are just counting the total number of the daughters a female will bearing. The in the GFR and the TFR, we are counting about the total number of the child. We are not assuming the male or the female. Total child will be given. Okay, but in the GFR, please remember, we are in the GRR. In the GRR, please remember, I'm mentioning here the question. We are talking about the daughters of the female which bearing in the reproductive years, assuming the current age and the specific fertility rates in the current space in the fertility rate. So this is GRR about the your daughters. The next is your NRR. Please remember where is the RR. Okay, GRR and RR, that we are talking about the daughters. In this we are talking about the daughters, and where we are talking about the fertility rate. In the fertility rate we are talking about the children. No male specifically, no about the females, right? So in this in this NRR, there is the total number of the daughter a newborn girl child which is bearing during her entire life, which is assuming with the fixed age and the specific fertility. Please remember here, there will be the fixed age, not the current age. There will be the fixed age and the specific fertility rates and the age specific death rate. This will be your NRR. So you have to remember about the your crude birth rate, about your crude death rate, and your GFR, TFR, GRR, and the NRR. These, by the definition, you have to remember. Just remember about the crude birth rate and the crude death rate. They can ask you about the counting the formula also. They can ask you about the formula also, right? And now we, after that, we are starting with the vital registration system. Now after this there, and just I'm mentioning here, this is the already here 1:30, or sorry, 1:50 will be the timing. So till the 2 o'clock there will be the 10 minutes break will be here. Okay, 10 minutes break I'm taking here. After this 10-minute break, we'll continue the class at the sharp 2 o'clock. Okay, and we'll start the continuing this vital registration system. Okay, we're starting the vital registration system. Okay, guys, just taking the 10 minutes of the break. Okay, okay, this the time is already 1:50. Till the 2 o'clock there will be the 10 minutes break. Hello guys, break is over. Let's start the class. Let's start the class. Am I clearly audible and visible? Let me know in the chat box once. Let me know in the chat box, guys. I'm waiting for your replies. Am I clearly audible and visible? Should we continue the class? Okay, okay, perfect. ठीक है. Let's start. Let's start the vital registration system. Okay, let's start the vital registration system. In this vital registration system, we have some specific days and some specific criteria which you have to remember from this list. I'm starting with the first one. There is a birth. So, as the birth of a child, that should be registered in this vital registration system within a 21 days. As you already know, the birth certificate, right? So you have to get the registered that this child was born to this was the father's name, this was the mother's name, and that should be registered in the vital registration system under within the 21 days, within a 21 days, that is known as from the birth. This is the fourth, but the same thing is for the same thing is for the your death also. That should be registered as a death certificate should be registered into the within a 21 days of the death, right? So the within the 21 days of the birth should be the birth registration should be done. The within the 21 days of the death, there will be the death registration should be done. With this, there's a marriage registration also will be there. The marriage certificate, as you already know, this is depending on the state. There is a dependency on the state will be the different. So there will be the done with between the this on the dependency on the state. The marriage certificate will should be done. The important question, which is your PYQ, please remember this is your PYQ, that there's a birth of a child to NRI couple. This is a birth of a child to a NRI couple abroad. Should be registered within, please remember, should be registered within the 60 days up to the arrival in the country. So when the NRI couple is there, they had a child, right, in the abroad, and when they come back to India, just please remember, when they come back to arrival the country, as they arrive to the country, they have to register within a 60 days. They have to register the child within a 60 days, right? So this is the criteria for the NRI couple. Okay, so please remember this was the PYQ. They asked you the question, the one couple was having a child like that and that, and when they come back to India, come back to the India in whatever the days, whatever the limit of the days, they have to. So they given you the 30 days of the birth, 60 days of the birth, 30 days up to the arrival in the country, and the 60 days arrival into the country. Please remember this will be your 60 days up to the arrival in the country. When they arrive into the country, then only they can register. Okay, then only can they register, right? And the birth register, please remember, the birth registration is a responsibility of the hospital and the institution of the birth. जहाँ पर बच्चे का birth हो रहा है, where the birth of the child, that should be the responsible for the birth registration. They will do the birth registration. They will give you a certificate of the birth certificate, and then you have to make the your vital registration. Understand? This is about the registrations. Now we are talking about the next important thing, which is your literacy rate. What is the literacy rate? I hope you know about it. How many people are the literate? This is known as the literacy rate, and we have nowadays we have the 75% is the literacy rate of the India. We have the 75% of the literacy rate of the India. What is the literacy rate? How we can count the literacy rate? So please remember the literacy rate is the number of the literate peoples and the total people. Please remember the total people is the 7 year and the above. We are counting the 7 year or the above. Please remember, right? Not less than the 7 year will be not counted in the literacy, right? So the total people, the total population who have the age or the 7 year and the above will be multiplied with the 100 is the our is coming our literacy rate. So please remember, in the literacy rate, our total literacy rate is our 75 literacy rate. And if we talk about it, what is the Male literacy rate, please remember the male literacy rate is the 82%. The male literacy rate is the 82%. And if we're talking about the female literacy rate, the female literacy rate is to the 65%. The female literacy rate is the 65%. If we're talking about the highest literacy rate is seen in your Kerala. 94% will be seen in your Kerala. 94%. And if we're talking about the lowest, if we talk about the lowest, that will be in your Bihar, 64%, the 64%, right? So if you're talking about the literacy rate, number of the literate divided by the total people we have in the age from 7 year and the above multiplied by the 100, and this is about your literacy rate. The total literacy rate is the 75%. If we're talking about the males, the 82% is the males are the literate, and the 65% of the females in India will be literated. And highest will be in your Kerala, 94%. Very well, right? It's a very good thing that 94% literacy rate in the Kerala, and the lowest, if we're talking about this, is the 64% in your Bihar, right? Moving forward, that also this is also used in the calculation of PQLI. What is your PQLI? Please remember that is your physical quality of life index. And the next with the PQLI, this is also need in the HDI. What is your HDI? Please remember this is your human development index. This is your human development index, right? So this is all about your vital, this is all about your vital registration. So right, so this is the questions. If I'm talking about the questions here, the question is from the birth registration, death registration, and the couple who are having NRI couple birth registration, right? These are the questions, and the question can come from your literacy rates. You have to remember for the literacy rate, please remember the formula of the literacy rate also, right? Now moving forward for the next thing, this is about your growth rate. Now starting with the next about your growth rate. What is the growth rate? If we're talking about it, this is based on the India at the very rapid growing phase, and this is the doubling the population within the 35 to 47 years, right? So the 35 to 47 years, just after this there will be the double, there will be the double of the growth will be seen there, right? There will be this. So India is in a very rapid growth phase. Please remember, if we're talking about it, India is in the very rapid growth phase. Okay, if we're talking about the growth rate, about the annual growth rate, in the annual growth rate there is the 1.64%. 1.64% is your growth rate is annually. And if you're talking about the decade, if you're talking about the 10 years in the decade, so in the decades it will be your 17.64. It will be your 17.64%, right? This is on the based on the India, right? So this is in this depending on this India, you can see here after this 35 to 47 years of the age, there will be the doubling of the population will be seen. So this is about the growth rate of the India. This is all about the growth rate of the India. Already, doctor, I already told you about the PDF. Please, after this session, the link of the PDF will be in your comment box and in the description also, right? I will pin the comment, the link I will post it into your comment. You have to click on that link and you will get the PDF of this session. You will get this PDF of this session shortly, right? So this is about the annual rate. You have to remember the annual growth rate, decade growth rate, and the doubling of this population will be seen after the 35 to 47 year of the age. The next thing we have to talk about the sex ratio. We have to talk about the sex ratio. What is your sex ratio formula? The sex ratio formula is saying the number of females divided by number of males multiply with the 1,000. So number of the total females and number of the males with the multiply with the 1,000 will be coming to your sex ratio. If we're talking about it, now, now the females are the 943 females divided by the 1,000 males is the highest in the Kerala. Okay, so highest sex ratio will be seen in the your 943. The 943 females are there, which is on the 1,000 males. And if you're talking about the lowest sex ratio will be seen in your Daman and Diu, right? Sorry for it. So the highest sex ratio will be seen in your Kerala, which is your 943 females. upon the 1,000 males. And if you're talking about the lowest one will be seen in your Daman and Diu, will be seen in your Daman and Diu. Now I am moving forward for the child sex ratio. We talked about the sex ratio, right? There we didn't mention the any age. We just mentioned the number of the females divided by the number of males. But here in a child sex ratio, please remember we have the number of females 0 to 6 years divided with the males from the 0 to 6 years multiply by 1,000. So this will be giving us the count of child sex ratio. This will be giving us the count of child sex ratio. All right. So now you understand the growth rate, sex ratio, and the child sex ratio. Did you understand till here? Let me know in the chat box. We'll continue further. Right. Now the next thing, we are starting with the next topic, which is our which is our family planning and the contraception. This topic is having the both the it is covering the both side of it. It is covering your obs and gynae part also, and it is going to cover your PSM part also, right? So starting with the first thing, that is covering your conventional that is covering your conventional contraception. We're starting with the first one, which is your conventional contraception. What do you mean understand by the conventional contraception? This contraception will be used at the time of intercourse. This will be this will be used at the time of intercourse only. Like you can understand, the first thing will be your male condoms and the spermicides. The condom and the spermicide. There will be the spermicide. You remember which spermicide? The naloxone 9. The naloxone 9 will be used, right? And what will be done by this naloxone 9? This will be going to rupture the acrosome of your sperm, right? This will be going to rupture the acrosome of your rupture of the acrosome of your sperm, right? This is about the conventional contraception. So please remember, the conventional contraception will be used at the time of intercourse. Okay, at the time of intercourse will be used. Talking about the intraceptive, the next we are talking about the intraceptive. This intraceptive will be used after the intercourse. That will be used after the intercourse, and that is known as your postcoital, or you can say the emergency contraception also. This will be known as a postcoital or the emergency contraceptive. This will be known as the emergency contraceptive. What will be the emergency contraceptive or the postcoital one? So the first one is your combined OCP, combined oral contraceptive pills. So there will be the combined oral contraceptive pills, and there will be the method which is known as your UPs and LANs, which we use the less than should be used in the less than 72 hours of the intercourse. Okay, after the intercourse, within the 72 hours you have to use. The next we have the progesterone only pill. Pops are there also. Progesterone only pills, the pops will be also within a 72 hours should be used, will be there. Next, we have the IUCD. Please remember, which is the IUCD is also the highly efficacy, which is having the highly efficacy, and it is should be done the less than the within a 5 days after the intercourse, within the 5 days of the intercourse. Then we have the RU, we having the RU 486, which is your nothing. This is your mifepristone. This is your mifepristone. And please remember, this mifepristone is also used within the 72 hours of the intercourse, which is used in the 72 hours of the intercourse. And last one, which is the important, which is your high dose estrogen, which is used as a high dose estrogen. This high dose estrogen will be used within a 5 days. Within a 5 days. So you have to remember, we can use the combined oral contraceptive pills also, which is the UPs and LANCs method, and we have the progesterone only pills also. The if you're talking about the highly efficiency, that will be your IUCD, that will be your intrauterine device. Okay, mifepristone is also used in a emergency contraceptive. So we understand about the conventional contraceptive, which we used at the time of the intercourse. Then we have the intraceptive, which will be used after the intercourse, and that I already told you. Now I am moving forward for the next thing about talking about the eligible couple. Now I'm talking about the eligible couple. What is the mean by the eligible couple? The eligible couple, sorry guys, talking about the eligible couple, this is the married wife. This is a married wife is wife is at the reproductive age. It means it is from the 15 to 49 year of the age, right? This is the married wife. A married girl or married wife is in at a reproductive age. What is the reproductive age? 15 to 49 year of the age, and this is the eligible for the available contraceptives. And this is the eligible for the available contraceptives. This is known as the your eligible couple. If we're talking about the eligible couple rate, this is the eligible couple rate is your 150 to 180 eligible couple rate into the divided by the 1,000 people populations, right? So what is the eligible couple rate? This is your 150 to 180 eligible couple. So what is the eligible couple? One female who is a married please remember, the married female who is in the reproductive age, and which is she is eligible for the available contraceptives. That is your eligible couple. That is your eligible couple. Talking about the next, for the couple protection rate. Talking about the next is your couple protection rate. This is your CPR. This couple protection rate is saying that there will be the number of protected couple divided by the total eligible couple multiplied by 100, right? So there will be the, in a couple protection rate, what we are seeing in the couple protection rate, please understand this thing, that there will be the, in the couple protection rate, there will be the number of protected couple. There will be the number of the protected couple divided by the number of the total eligible couple and multiply by 100. So if we're talking about it, the this your couple protection rate will be more than 60 will be needed. There will be the more than 60 will be needed, right? If we're talking about the India, so please remember, now in India the couple protection rate is about near to the 67%. This is about the near to the 67%, right? So this is this is about your CPR, couple protection rate. The next is we having the NRR, which is we are having the NRR. We already talked about the NRR also, which is your net production, which is your net reproduction rate. The net reproduction rate will be your is equal to 1 in the demographic fertility indicator, should be the is equal to 1 will be in the demographic fertility indicator, right? So this is about the couple eligible couple, your couple protection rate, and about your NRR, right? Now moving forward for the important topic, very important topic, which is your previous year topic also, and the important topic also is your Pearl index. We are talking about the Pearl index. This is your PYT, PYQ also. Okay, so we are talking about the Pearl index. Now what is the mean by this Pearl index, guys? Please try to understand the Pearl index. This is the used to this is the used to assess the failure rate of contraceptive efficacy rate. This will be the used to, this Pearl index will be used to assess, this will be the used to assess the failure rate of contraceptives. This will be the use for the failure rate of the contraceptives. And this is giving us the contraceptive efficacy rate also, right? So used to assess the failure of the contraceptive, and we'll get the efficiency of this thing. So this will be expressed, this will be, please remember, this will be expressed per 100 women divided by the year. Please remember, this will be expressed as the per 100 women per year, right? So per 100 women in the per year. So if we're talking about the formula of the Pearl index, please remember the formula of the Pearl index. The formula of the Pearl index is saying the number of total accidental pregnancies. If we're talking about the total number of the accidental pregnancies divided by the total months of exposure, total number of the total accidental pregnancies, which is divided with the total month of the exposures, multiply by the 1200. Why the 1200? Please understand this 1200, because as I already told you, we'll talk about the per year. So in year we having the 12 months, we having the 12 months. So the 12 month multiply by the 100 should be the, in the percentage, we'll be getting the percentage, right? Rate will be given in the 100. So we multiply the 100 with the 12, so that will be the 1200. So please remember, this will be the 1200, not the 1000. They can ask you about this also, right? So there is the number of the total accidental pregnancies divided by the total months of the exposure multiplied with the 1200, and this will be giving you the Pearl index. If I'm talking about the Pearl index, please remember the male condom is having the Pearl index of 2 to 14, 2 to 14, 2 to 14 women will be uh, per 100 women per year, right? So per 100 women per year will be the Pearl index of the male condom. If we're talking about the vaginal sponge, if you're talking about the vaginal sponge, it is having 9 to 20, 9 to 20 per 100 women per year, per 100 women per year, right? So this will be the Pearl index of our vaginal sponge, right? Did you understand till here? Right, about the Pearl index, this is a very important. So what we are getting counting, we are getting efficacy, how much is the efficiency of this contraceptive is there, right? So this is about the efficiency or efficacy of this uh, uh, particular contraceptive, right? As I given you the example, the male condom is having the 2 to 14, the 2 to 14 per 100 women per year, right? Per 100 women per year, right? So this is about the Pearl index. So now we are moving forward for the more contraceptives. One by one we have to talk about it. So starting with the first one, which is about your female condom. We're talking about the female condom, and please remember this is the having high, this is the higher, it is having the higher Pearl index or the failure rate. This is having the higher Pearl index or the higher failure rate. What is the rate? This is the 5 to 12 100 women per 100 women per year, right? So this will be having the 5 to 12. And it is, please remember, if we're talking about a structure, this is having the two rings and having the more longer size. You can see this is the ring number 1 here, and this is the ring number 2 will be here. So this is the longer in the size and having the two rings. It is having the two rings, and please remember this is the transparent, this is the transparent made up by the polyurethane. This will be used as the poly urethane, right? This will be used as the polyurethane. And please remember, this is the reusable, this is the reusable contraceptive, this is the reusable contraceptive, and this is the HIV protected as it is a barrier method, right? So the female condom is coming into your barrier method, right? So this is the making the HIV protection. But there is a must thing which you have to remember, this should be inserted 2 hours prior and prior the intercourse, and will be not removed the 2 hours after the intercourse. So it is having a thing which should be mentioned here, that this female condom should be used or the inserted before the 2 hours prior of the intercourse, and should be not removed, this should be not removed 2 hours after the intercourse also, right? And this is the reuse, this is the reusable contraceptive. You can see by the image also, please remember the image also, they can ask you just by the given also. Please remember the male condom is having only the one ring, but the female condom is having the two rings. This is having the two rings and the longer size. Understand? This is about the this. Now we are talking about the next one, which is the vaginal sponge. We are talking about the next topic. This is about the vaginal sponge. Please remember, this is the non-conventional. This is the non-conventional contraceptive. This is the non-conventional contraceptive, and the indication of this vaginal sponge. Please remember, this is inserted 4 hour prior. This is inserted in the 4 hour prior and not removed 4 hour after the intercourse. This is the indication for the using of the vaginal sponge, that should be inserted the 4 hour prior of the intercourse and should be not removed after the 4 hour of the intercourse. That's why this can cause to the TSS, the toxic shock syndrome. This can causing you the toxic shock syndrome, TSS. And this is also a barrier method, this is also type of the barrier method. And here we are using a spermicide, the spermicide used on this vaginal sponge, which is your naloxone 9. This is your naloxone 9, right? So the naloxone 9 will be used here. If you're talking about the vaginal sponge Pearl index, that should be your 9 to 20, 9 to 20, 9 to 20 per 100 women per year, per 100 women per year, right? So this is about the vaginal sponge. You can see this is the vaginal sponge which is available in the market by the brand name of the Today, right? This is the Today, and this is the woman's contraceptive. You can see this is the today, this is the vaginal sponge, and this sponge should be put it on the cervix. This sponge should be covered your cervix, and this is also a kind of a barrier method. This is also a kind of a barrier method, right? Please remember the your spermicide. The spermicide will be used, and naloxone 9 should be used here, right? This is also in the barrier method. Now moving forward, for the next is your combined oral contraceptive pill, combined OCPs. We are talking about the combined OCPs. In the combined OCPs, we having the estradiol estrogen will be the 30 mgc, and we having the LNG, right? Will be in your 150 mcg in a per pill. Remember, this will be in the first 21 pills. That should be you having the total 28 pills. You are having the in this OCP packet, you are having the total 28 pills, and the first 21, please remember, the first 21 pills, which is which is your containing of the estrogen will be the 30 mcgs, and the LNG will be covered your 150 mcgs per pill, right? Per pill we are talking about in the first 20. What about the last 7 tablet? Please remember, the last 7 tablet is having the 60 mg of the ferrous fumarate. This is having the 60 mg of the ferrous fumarate, and this is the last 7 is the red color pills. Okay, this is having the red pills. Okay, this is covering of the ferrous fumarate, because there will the menses will be occurring after this using of this OCP. So in the menses there will be the loss of blood will be there, so this is given, the famous fumarate will be given as the iron will be given, so it will not causing the anemia, right? It is not causing the anemia, right? So in the first 21 pills will be covering, first 21 pills will be covering your uh, OCPs, oral combined on. Please remember, this is a combined, because there will be or both will be used. The estrogen will be used, LNG will be also used, right? So levonorgestrel, right? Levonorgestrel will be used. So the both will be used. So this is the combined oral contraceptive pills. There will be the two type of the combined oral contraceptive will be available in the market. The first will be the Mala, and the second will be your Mala D, right? So the first will be the Mala N, which is then free of cost, provided by the government. This is your Mala N, right? This will be the Mala N, which is provided by the government, which is the free of cost. And please remember, the Mala D is the 3 rupees to 5 rupees per packet. Okay, the 3 rupees to 5 rupees per packet. This is the Mala D, which is available in the market. So the Mala N and Mala D will be available in the market in the combined oral contraceptive pills. In the combined oral contraceptive pills. Please remember, the Mala N will be provided by the government schemes, which is the free of cost will be available, rather than the Mala D is costing 3 rupees to 5 rupees. Please remember, right? It was the old price was the 3 rupees. Nowadays it is coming in the 5 rupees per packet. Okay, it is the 5 rupees per packet. Is this about the combined oral contraceptive pills? Moving forward, for the next is about your intrauterine devices. We are talking about the IUCDs. These IUCDs are the intrauterine devices. We are talking about, this is having the generations. The old generation was having the Lippes loops, and this will be the discarded due to the high failure rate. The Lippes loop was discarded due to the high failure rate, and now the most commonly used is the copper T 380A. The copper T 380A, you can see in this image number 1. This number 1 is having the copper T 380A, and you can see this is having the copper on the arms also, and it is having the thread also in the last. So this is your copper T 380A. This is copper T 380A. India and the worldwide, the shelf life, please remember, the shelf life of this copper 380A is having the 10 years of the shelf life. Please remember, this is your PYQ. This is your PYQ in the intrauterine device. The copper 380A is having the shelf life. Please remember the shelf life of the 10 years. So with this, we having the copper copper T 375. We are having the copper T 375, and which is having the shelf life. It is having the shelf life of 5 years, which is known as your multi-load copper T, which is the multi-load copper T. You can see in this image number 2, I'm showing you, this is the your multi-load. This is known as the your multi-load. You can see this is having the multi-loads, right? So this is known as the multi-load, and this is your copper 375, copper T 375. Please remember the shelf life of the 380. Copper T 380 is 10 years. Copper T 375 375 for the 5 years. So remember, for the last digit, the 380 is having the 0, it means the 10 years, and 375 is having the 5, it means the 5 years, it means the 5 years. So remember the shelf life of it, the shelf life is the PYQ, right? Copper 380 का shelf life पूछा गया है previous year questions में 10 years. So now they can ask you about the 375 again, or 375, or maybe they can ask you again about the 380 shelf life. So this is about the intrauterine device. This device will be inserted into the uterus, and this is used for the contraception, right? This is also the contraceptive. The next we are having the diaphragm. We are having the next we are having the diaphragm, and this diaphragm is also a type of a barrier method. This is also a barrier method. With this barrier method, this is also a non-conventional method. This is the non-conventional method because this is also having the indication. This is also having the indication inserted to the 6 hour prior to the intercourse, and should not removed for the 6 hour after the intercourse, right? So as the female one was having the 2 hours prior inserted and should not remove for the 2 hours. The next we having the vaginal sponge. Vaginal sponge was the 4 hour prior will be inserted and not removed for the for the after the intercourse the 4 hours. This is having, this diaphragm is having the 6 hours. The 6 hour prior it should be inserted, and it should be removed, the not be removed after the 6 hours of the intercourse. So please remember, this is the indications of diaphragm. Please remember about the complications. Again, the same thing, as it will be not removed for the after the intercourse of the 6 hours, it can cause you TSS, toxic shock syndrome, along with spermicide. It can cause that along with the spermicide, right? And please remember, this will be not preferred in the developing country. This will be the not no, not this will be the not preferred in the developing country, and the females looking for the temporary spacing. This will be, there will be, the female will be looking for the temporary spacing, right? So this is about the diaphragm. You can see this is your diaphragm. This is about your diaphragm, right? This is also type of a barrier method. This is about a barrier method and the non-conventional contraceptive. Next about, we are talking about the antara. We are going to talk about the antara. And please remember, what is this antara? This antara is consisting of the DMP. This is having the antara is having the DMPA. And what is this DMPA? This is having the depo dipomethroxyprogesterone acetate, right? Which is also known as your depot formulation, right? This is the depot formulation, right? So DMPA, this will be an injectable type of, this will be an injectable type of the contraceptive. This will be an injectable type of the contraceptive. And please remember, this will be injectable in a intramuscularly injectable. This will be injectable in the intramuscularly injectable once every 3 months. This will be having the once every 3 months. And what amount of DMPA? The 150 mg of DMPA should be the 150 mg 150 mg DMPA will be injected in the intramuscularly. This will be injected into the intramuscularly. This is having a side effect. The side effect of this antara is having the irregular cycle. It can disturb your cycles, and there will be the irregular cycles will be seen with the intra, right? Remember the image also. This is also the IBQ image based question can be asked. What is this antara? And they can ask you what this is consisting, or how much amount of this. So it is consisting of the DMPA. Please remember DMPA, how much? This is having the 150 mg 150 mg DMPA. Okay, this is having the 150 mg DMPA, right? Dipomethroxyprogesterone acetate, right? Dipomethroxyprogesterone acetate, right? DMP. And remember this is used in the intramuscularly, and this will be having the use once every 3 months. This will be used as a once every 3 months. The next we have the chaya. The next contraceptive we having the chaya, and this is also the brand name in the market is available as a Saheli, right? Please remember the Saheli, and please remember this is the non-steroidal, non-hormonal OCP. This is the non-steroidal, because the OCPs which were used in the Maladi and Malayan, they can having the steroidal. These are the type of the steroidal. This is the type of steroidal contraceptive, and they are the hormonal also. They are having the hormones, right? They are having the levonorgestrel, and they are having the estradiol estrogen, right? So this is developed by the CDRI Lucknow. Please remember this Shaya and the Saili was developed by the CDRI Lucknow, and having the this is having the only this is having the omilofexin, right? And this is having the serum. This is having the selective estrogen modifier. This is having the selective estrogen modifier. This is having the kind of selective estrogen modifier. And if you're talking about the Pearl index, this is having a very low Pearl index, which is your just 1.842 2.84 100 per 100 women per year, right? And just remember, this will be the contraindicated. This will be the contraindicated in the POCD cases. This will be the contraindicated in the POCD cases. The best thing, this should be the one pill for a week. This will be the once a week pill will be used in the OCP, that should be carried daily. That will be the daily a pill, right? OCP हमें क्या use करनी पड़ती है? Daily a pill should be used. Talking about the Chaya and the Saili, there should be the one pill should be used. One should be given in the once a week. So this is the Chaya. You can see this is the pack of the Chaya, and this is the Saheli, right? So remember this. This is the non-steroidal and the non-hormonal contraceptive, right? Next, we have the Nishchay. Next, we have the Nishchay. Please remember Nishchay, not the Nikshchay. Nikshchay is a very different. Nishchay. Please remember Nishchay. What is a Nishchay? Nishchay is a home-based pregnancy testing kit which is provided by the National Health Mission, right? And HM is providing the home-based pregnancy test kits, right? The NHM is providing the home-based at the NHM is providing the home-based pregnancy testing kit, and this is known as your niche. This is known as your niche. After this, completing this contraceptives, and now I'm moving forward for the next about the antenatal visits. Talking about the antenatal visits. If we're talking about the antenatal visits, how much will be total antenatal visits? Please remember that should be recommended 13 to 14. That should be your 13 to 14 antenatal visits should be recommended here. How much? Guys, try to reply in the chat box how much recommendation for the antenatal visits. Let me know in the chat box how many antenatal visits should be recommended here. How much should be recommended here? The antenatal visits. Yes, it should be your 13 to 14 13 to 14 visits. It should be your 13 to 13 to 13 to 14 visits. How will be the 13 to 14 visits? Please remember the 0 to 7 month of the gestation, right? There's the 0 to 7 month of the gestation. There will be the once in the month. There will be the once in the month. So it means till the 7 months, there will be the 7 visits will be there. Antenatal visits हो गई. 7 visits will be there, because as from the 0 to 7 month, right? 0 to 7 month, there will be the 7. Once a month, it should be recommended the antenatal visit. And after, in the 8th month of the gestation, in the 8th month of the post gestation, there will be the twice in a month. So it means in the 8th month, there will be the 2 visits should be done. 2 visits should be done. And after the 9th month onwards, there will be the 9th month onward, there will be the once in a week. There will be the once in a week. So it will be 4 to 5 visits. So if you're totally counting the all the if you are counting all the visits, this total visits will be the 13 to the total visits will be the 13 to 14 visits in the antenatal visits. Please remember the antenatal before the delivery only. ओके, डिलीवरी से पहले पहले के काउंट्स कर रहे हैं हम लोग, ठीक है. हाउ मच विजिट्स? देयर विल बी 13 टू 14 विजिट्स फॉर द गायनोकोलॉजिस्ट, ठीक है. 0 to 7 month of the post gestation, there will be this once in a month you have to visit. Total will be the 7. Total will be the 7 visits should be done. And after that, if we're talking about the 8th month, in the 8th month of the post gestation, we have the twice in the months. It means the 2 visits will be done in the 8th month, and in the 9th month, we have to do the onwards once a week. Once a week will be done. So it will be the total 4 to 5 visits will be in the 9 months. Talking about the minimal. Now the next thing, the minimal. The recommendation is the 30. Please remember 13 to 14 is a recommendation. But if they're talking about the minimal antenatal visits, the minimal antenatal visit, the RCH program is saying the more than 4 should be done. And what is the more than 4 should be done? The first visit should be at the time of registration. It means when the patient will be get to know about the pregnancy or the gestation, that will be the first visit at the time of registration. After that, the second visit should be done at the 14 to 26 week of the post of the gestation. Third visit should be done at the 28 to 34 weeks of the post of gestation, and the fourth visit should be done at the 36 week of the gestation, which can be known as the term, right? So the minimum, what is the minimum? What is the minimum antenatal visits? Please let me know in the chat box. I'm waiting for your comments. What is the minimum antenatal visits and what is the recommendation? देखो minimum जो है हम उसकी बात कर रहे हैं. So minimum should be more than 4. And what is the recommendation? What should be recommendation? The recommendation is the 13 to 14 will be there. Okay? So recommendation is 13 to 14. 13 to 14. Very good. Very good, right? So minimum should be the, as per the RCH, will be the more than 4. Now after this was about the all about, this was all about your, very good, this is all about your antenatal. Now I'm talking about the postnatal visits. Now I'm talking about the postnatal visit. In the postnatal visit, there will be the 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 MPM, which is the female, or the ANM should be done in the visit. And what will be the postnatal visit? By this, there will be the 3 to 4 visits should be done in the postnatal period. In the postnatal period, there will be the by the ANM or the MPW, right? This will be done. The MPW and the ANM will be doing the 3 to 4 visits. And please remember, please remember why this is the 3 to 4. If there will be the institutional delivery, maybe the baby is delivered on the sub-center, PSC, CSC, hospital, or the institution, there will be the 3 visits should be done. There will be the 3 visits should be done. If the if the if the child is home delivered, please remember, if the child is the home delivered, there should be the 4. There should be the 4 postnatal visits should be done. Should be the 4 postnatal visits should be done. If we're talking about it, that on the day, if what will be the days in the institutional delivery, there will be the day 3, day 7, and the day 42. Day 3, day 7, and the day 42 should be in the postnatal visits of the of the institutional deliveries. If we're talking about the home-based delivery, the day 1, day 3, day 7, and the day 42. So the days are the same in the institutional delivery, 3, 7, and 42, because on the day first, that if the institutional delivery, the child was in the hospital only, right? वो भी कहाँ होगा? Hospital only. So there will be the no need of the postnatal visit in the institutional delivery on the first day, right? In the institutional delivery पे first day का कोई mean ही नहीं है, first day postnatal visit का कोई mean ही नहीं है. But in the home delivery, please remember, if the home delivered baby is there, so you have to do the on the first day also you have to do the postnatal visit. You have to do the postnatal visit. So please remember the 3 to 4 visits should be should be in the postnatal visits. Understand? And that should be done in the institution delivery 3, which will be 3rd, 7th, and the 42nd day. And if you're talking about the home delivery, the first day, 3rd day, 7th day, and the 42nd day. This is about the postnatal visits. Now we are moving forward for the ASHA. What will be the ASHA is the home based nursing care in the 6 to 7 visits, right? What will be there if the institutional delivery, ASHA, ANM will be done 3 to 4 postnatal visit. What about the ASHA if the institutional delivery? Mention this, if the institutional delivery, there will be the 6 visits will be done, 6 days will be done. And if the home based delivery, there will be the 7 days visit should be done. What was by the ASHA? Please remember, again there will be the on the day 3rd, day 7th, 14th, 21st, 28th, and 42, right? Just remember this numbers of it. In the institution delivery, ASHA will be going to visit 6 days, 6 visits will be done. Okay, how much the total visit? The 6 visits. On which days? on the third day in the institutional, third day, seventh day, 14th day, 21st day, 28th day, and the 42nd day. With this, the same only, if we're talking about the home based, please remember on the home based, just we additionally add the seventh visits also. The seven visits, the first day, third day, seventh day, 14th, 21, 28, and 42. Because again the same thing in the institutional delivery, the child on the first day will be in a hospital only, right? In the hospital, on the PSC or the CHA will be there, right? The child will be not there at the home. So in the home based delivery, there will be the 7 visits by the ASHA, and the institutional delivery 6 visits. Please remember the days about this is the very important. The days you have to remember: 3, 7, 14, 21, 28, and the 42. This should be by your in the institution delivery by the ASHA. And just add the one here, the 1, 3, 7, 14, 21, 28, and the 42 will be done by your in a home based delivery by the ASHA, right? Home based delivery by the home based delivery, in a home based delivery, the visit by the ASHA. You have to remember it. Now I'm moving forward for the next thing. It is about your birth weight. Talking about the birth weight. In the birth weight, this is important. What should be nowadays the average birth weight? The average birth weight is nowadays in India, average birth weight in India is now the 2.8 kgs. So 2.8 kgs should be in the average birth weight. If you're talking about the WHO classification, please remember the WHO classification is saying the the low birth weight. What is a low birth weight? If the child is having the birth less than 2.5 kgs, this is the 18% of the prevalence, right? This is the 80% of the prevalence. So this is the patient is having the low birth weight. It means less than 2.5 kgs, the low birth weight. If the patient is having the less than 2 kgs, the baby is delivered is the with the birth weight of the 2 kgs, that will be your mild low birth weight, right? Which will be your mild low birth weight. Then we have, if the child is less than 1.5 kg, that will be the very low birth weight. That will be your very low birth weight, 1.5 kg. And please remember, if the child is having just weight of less than 1 kg, less than 1 kg, that will be your extreme low birth weight. That should be your extreme low birth weight, right? So please remember the average average birth weight in India is your 2.8 kg, 2.8 kg. And if you're talking about the WHO classification, the WHO classification is given on the based on the, if less than 2.5 kgs, it will be the low birth weight. Less than 2 kgs, it will be your mild low birth weight, right? If with the less than 1.5 kg, that will be your very low birth weight. And if it is less than 1 kg, the child is having the birth weight of the less than 1 kg, that should be your extreme low birth weight. That should be your extreme low birth weight. Now, if we're talking about the term, what is the preterm? The preterm is the word, is the if the gestation is having the less than 37 of the weeks. What is the term? The 37 weeks to 42 week is known as the term. And what is the post term? If the pregnancy is more than the 42 weeks, more than the 42 weeks. This is you already know by your OBG, right? OBG, right? This is you already know by your OBS and gynae subject, right? Should we move forward? Birth weight समझ में आ गया है? ठीक है. Now we are moving forward for the next is about the breastfeeding. Now we are moving forward for the next for the breastfeeding. Important breastfeeding. MCQs can become from the breastfeeding. Please remember the breastfeeding. In the breastfeeding, this please remember the exclusive breastfeeding. What do you mean understand by the exclusive breastfeeding? That should be your 0 to 6 month. In this age, 0 to 6 month of the age, child should be not given any other thing. Just should be only and only mother milk or the breast milk be given in this age of the child, right? What is the important of this breast milk? The breast milk is containing the IgA, the antibodies. Please remember the antibodies IgA, DHA, high in iron and low in calcium. This is having the high in iron and the low in the calcium. If we're talking about the energy content, it is having the 65 kilocalories. It is having the 65 kilocalories, 65 kilocalories per 100 ml, right? Sorry for it. If we're talking about the proteins, the protein is 0.9 to 1.1 per 100 ml, right? And please remember, what is the thing about the breastfeeding? For the breastfeeding, is this will be is the given that it should be started after, as soon as possible after the birth, as it should be starting soon after the birth. Please remember, in the normal vaginal delivery, it should be this in the normal genital. This will be the in the normal vaginal delivery. It should be less than 1 hour. It should be started in the less than 1 hour. And if you're talking about the cesarean section, in the cesarean section, it should be started in the less than 4 hours. It should be started at the less than 4 hour. Please, this is the MCQ here. Please mark as a question. This is a very important question, right? And this should be started will be the at what time should be started this breastfeeding? It should be started in the normal vaginal delivery, it should be started less than 1 hour, and in the cesarean section it should be started more than 4 hours. And please remember how it will be going to start it. It will be, the breastfeeding, the breast milk will be starting injecting by this oxytocin release. This will be started by the oxytocin release, and this will be by the early explosion of the placenta or the lesser MMR. It will be seen in the lesser MMR, right? This is about the breastfeeding. The important points you have to remember. Please remember the age of the child from the 0 to 6 month. 6 month will be the exclusive breastfeeding. It means there will be no additional things should be given. Just only and only mother milk should be given in this cases, right? Now we are talking about the properties of the screening test. This is a very important topic. For the properties of the screening test, we have the two important things. The first is about the sensitivity. The second we have about the specificity. The first we have the sensitivity. The second we have the specificity. So starting with the sensitivity, what is the guys mean sensitivity? The most useful is your sensitivity. Please remember, the most useful thing is in your sensitivity is the most useful in the screening test, right? And what is the sensitivity? The sensitivity formula is saying the A divided by the A plus C multiplied by the 100, or you can say the same thing. Please remember, I'm giving you a trick to remember this. This will be the true positive will be divided by the true positive and the false negative multiplied by the 100. You can understand? So where will be the two positive sign will be coming? The positivity will be there. Two positives you are seeing. The true positive divided by the true positive plus false negative will be there. False negative. Two positive, that will be. Remember, the two P's are there, right? Two P's are there. They will be seen in your sensitivity. Okay? दो P आ रहे हैं, sensitivity. Two P's are there, it means will be the sensitivity. The same thing, the next we having the specificity. What is the mean of specificity? Specificity is saying that your D is divided by B plus D multiplied by 100. It means it is going to say you the true negative divided by the true negative and the falsely positive multiply with the 100. So please remember where the two negative things will be there. Okay, positive are it means sensitivity. Two negatives are seen, that will be your specificity, right? So if they asking you about the formula, so just please remember two positive thing, one negative will be there, that will be in your sensitivity. True positive divided by the true positive plus false negative, it will be in your sensitivity. If they are asking about the specificity, in the specificity you have to go with the true negative divided by the true negative plus falsely positive multiply with the 100, right? So this is the properties for the screening test. For the screening test, please remember the important is your sensitivity. This is the important. Okay, so this is your PYQ also. This is your PYQ also, right? They ask you about the formula of the sensitivity. They will ask you about the formula of sensitivity, right? Now moving forward for the screening of the disease. Now we are moving forward for the screening of the disease. So in the screening of the disease, we have the many things. So starting with the first one is about the sensitivity. Just now only I given you the formula of the sensitivity. Any one of you guys can let me know in the chat box about the formula of the sensitivity. Just now I already told you the sensitivity, right? अभी अभी मैंने बताया स्क्रीनिंग ऑफ द properties in the screening, sensitivity, specificity. So let me know in the chat box the formula of sensitivity. Write it down. I'm waiting for your answers. Please try to write now only, right? Just only 2 days left for the exam, right? Try to write in the chat box. I'm waiting for your comments. I'm waiting for your comments. What is the formula? What is the formula for the sensitivity? What is the formula for the sensitivity? Write in the chat box. Write in the chat box. Write in the chat box, guys. Write in the chat box. I'm waiting for answers. Very good, very good. What I told you, what I told you. Very good. Sensitivity, it means I already told you two positive things will be there. So the true positive will be divided with the true positive plus, very good, false negative. ठीक है? Multiply with the 100. Very good, right? So the true positive, true positive will be divided with the true positive plus falsely negative. Just now I told you here, guys, please remember this. Remember this. This will be your PYQ. They can ask you the repeated times about the formula of the sensitivity. So the true positive will be divided with the true positive plus false negative multiplied by the 100. Okay, remember this. Okay, remember this, right? So this is about the formula of your sensitivity. And what is the mean by the sensitivity? Now you guys can understand that this is giving you the probability of having, this is giving you the probability of having test positive out of the total diseased, right? It will be giving you the criteria, it will giving the probability that is the having the test which will be the positively out, this will be the positively out from the total diseased, right? This will be your sensitivity, this will be your sensitivity. If you're talking about, if you're talking about the screening time, what is the screening time of the disease? Please remember the screening time of the disease, this is the time between the first possible point of the diagnosis and the critical time of the diagnosis. So this is the time, the screening time is known as the first possible point जहाँ पे हम patient को diagnose कर सकते हैं that the patient is having this disease. This time, starting from this time till to the and the critical time, the last time, the last diagnosis critical time, in this between, the points between in this two is known as your screening time. This point between this two is known as your screening time, right? This is known as your screening time. The next we having the lead time. The next we having the lead time. And what is your lead time, guys? Please understand, this is the time between, this is the time between the first possible point of the diagnosis and usual point of the diagnosis. It means, now I'm giving you this simple thing. Oh, what is the difference between the screening time and the lead time? The screening time is given us that we can diagnose this disease at this point till the end of this point, like in the 10 years we can do this. First point will be on the 17 year till the 27 years we can diagnose. This is the screening time. But what is your lead time? What is your lead time? Lead time is saying the first point was your 17 years, but at which point the most, the usually people are going to diagnose, it was maybe the 20, maybe the 21. So this 17 to 21, this 17 to 21 is your lead time. This 17 to 21 is your lead time, right? And this lead time will give you the, will give you the validity, accuracy and the preciousness, right? So this is the very good thing, the lead time and the screening time. I hope you understand between this both of the things, right? The next thing is about your specificity. What is your about? This is about your specificity. What is the specificity? Please let me know in the chat box the formula of the specificity. Let me know in the chat box the formula of the specificity. Specificity का formula कौन बताएगा मुझे? Fast write in the chat box. What is the formula? Please remember this formulas, guys. You guys are not understanding. This is a very important, very important. The true negative will be divided into the true negative plus falsely positive, right? So this will be given for the specificity. The true negative will be divided, the plus true negative plus falsely positive, multiply with 100, multiply with the 100. This will be your specificity formula. And what is the given, what is the given by the what is the given by this what is the given by, very good doctors, very good. What is the given by this specificity? This specificity will give you the probability of having tests negative out of this total health. So if we're talking about the sensitivity given the probably having the test positive out of the diseases. It means diseases person में से कितना ज़्यादा हमें test positive मिला है, कितने test हमें probably test positive मिले, that will be your sensitivity. But I'm talking about the specificity. This is the probabilities of having negative tests out of the healthy people, right? So this is about the specificity. If we're talking about the which is the most important is your sensitivity. Is the very important, all right? The sensitivity is your very important, right? And then we have the we have the positive predicted value. We have one thing which is known as your positive predictive value. What is the mean by this positive predicted value? This is the probability of having disease supposed to out of test is positive, right? It means there is a probability of having the disease, right, out of the test is positive patient. Like the one group of the people are there, right? They all the guys are having the out of this 100, out of the 100 there is a 70 is having the test is positive. But out of this 70, what is the probability, what is the probable is having the disease to suppose it, right? How many of these guys are having the disease, right? Maybe there was a falsely negative, was falsely positive was there, right? So we have to take see the this how much is the positively the guys are having the disease out of this. That is known as your positive predictive value. This is known as your PPV, positive predicted value. The next thing we have the validity. Next thing we guys are having a validity. What is the mean of this validity is, please remember this test measures what it is measures. This is the validity, right? So this is a simple thing that test measures what is this the measures. The validity is very simple thing. Moving forward for the next, which is the important, which is your negative predicted value. We talked about the positive, guys. We talk about the positive predicted value, PPPV, right? PPV. The next we have to talk about the NPV, which is your negative predicted value. In the negative predicted value, guys, in the negative predicted value, this is the probably is having disease out of the tested negative patient. It means we have a group of 100 patient. Out of this 100, there is a 30 is getting negative tested, right? 70 was a positive, but 30 is getting negative patient. Out of this 30 negative, which is tested negative patients, out of this 30, how much is having the probability to having this disease? Maybe out of this 30, maybe there was missed in this test. Okay, maybe this the test was the falsely negative, right? Falsely negative. So maybe the patient is having the disease but it has tested negative. So out of this tested negative person, how much is having the disease? This is known as your negative predicted value. This is known as your negative predicted value. Understand? Now you understand the positive predicted value and the negative predicted value. You understand the positive predicted value and the negative predicted value. The next thing, now I'm talking about the accuracy. Now I'm talking about the accuracy. What is the mean of the accuracy, guys? Please understand the accuracy. It means there will be the nearness. This will be the nearness to the true or the actual value, right? Accuracy, it means this is not the correct values. This will be the near to the true values. This will be the near to the true values or the actual values. It means this will be the accuracy. We are saying what is the accuracy rate of your MCQ solving, right? So your accuracy rate is not the actual correcting value. This is the near to the true value. This is the near to the true or the actual values, right? So this is about the accuracy. The next we have the receiver's operation characteristics curve. We have the receiver's operator characteristic curve, and this is the between this is curve between the same result on the repeat measurements, right? This is the same curve. We have the same results. One results will be there, and there will be repeated measurement should be done. And this is having a sensitivity and the one specificity, right? So there will be the receive operator characteristic curves. These curves between the same results. The same result will be there. The same result will be getting in the curve again and again, but it should be the repeated measurements. It will be having the repeated measurements, right? So this will be your into the sensitivity and the one it is one specificity, right? Next, we are moving forward for the test in series. We're talking about in the test in series. What the mean by this test in series? This is giving you the increasing. This is giving you the increase in the sensitivity. This is giving you the increasing in the sensitivity. And the last one, which is your precisions. And what by this mean? This is having the this is having the reproducibility and the repeatability getting the between the same results on the repeated measurement. So what we are doing between the same results, we on the repeated measurements we are doing, this is about the precisions, right? So this is all the screening of the diseases, all the important things I covered in the list. I hope you understand this all the things about the sensitivity, screening time, lead time, specificity, and positive predicted value, validity, negative predicted value, accuracy, receiver operator characteristic curve, and the Tassin series and the precisions. Right? All are the important. This all are the important. Please remember the just remember this definitions of this important words. Right? Please remember these definitions. I hope you understand till here, right? You understand till here? Should we move forward? Should we move forward? Let me know in the chat box. You understand? Should we move forward? Very good. Now, now I'm starting with the three important things which you have to understand. The first thing, which is known as your common source point exposure, all cases within. Now, what do you mean understand by it? What do you mean understand by it? Please understand there will be seen this graph. Please remember this graph. What you are seeing here in this graph, you are seeing this is going uphill sudden, and you are going up downhill sudden of the cases. So the cases is getting recognized and cases getting covered in these cases, right? But this is a common source. It means the infection or the whatever the thing is coming, this is coming from a common source, and it is having a point of this is having a point of exposure to the all the cases. It is having the single. Please understand, this is having the single wave seen with the rapid rise and the rapid fall. So the common source and point exposure in all the cases within which you will see the single wave. You can see यहाँ पर कितने waves दिख रहे हैं? Just only the one wave will be seen. Just I drawn with here, you can see this is the one wave only. And with this one wave, please remember this one wave, you are seeing this is the rapidly rising. This is the rapidly rising and the falling rapidly. This is falling rapidly also. So rapidly rise, rapidly fall will be seen in the common source point exposure. And with the example, you can understand the food poisoning. Guys, am I clearly audible now? It was a network issue. Let me know in the chat box. Let me know in the chat box. Guys, let me know in the chat box, guys. Am I clearly audible now? There was a network issue. Am I audible clearly and visible now? I'm not getting any chats from you guys. Is it going perfectly live now? Let me know, guys. Yes or no? Let me know in the chat box, guys. There was some technical issues due to that the server was down. I hope now it's connected and am I audible clearly and perfectly? Let me know in the chat box, guys. Let me know in the chat box. Audio or video is perfect. Should we continue this class? Should we continue this class, guys? Yeah, I think now it's going perfectly live, right? Okay, okay. Now perfect, right? ठीक है. Let's continue. Sorry for this disturbance. It was some technical network issues. Due to this, there was server down, right? So we was talking about the food poisoning. So what is the scene in the food poisoning that was from the common source? That cafe was the source for the your getting the food poisoning, and it is having a point of the source. Please remember, this is having the point of the exposure also. It is having the point of exposure also. It means at one point will be there. आवाज कम आ रही है? सब ठीक है? कंटिन्यू सर. I think sir can see your chat. No, I'm seeing your chat. I'm seeing your chat, guys. I'm seeing your chat. It was it was a delay, right? Okay. Now perfect. Audio. Now audio perfect, doctors. I think now audio will be perfect, right? आवाज अब ठीक है? Let me know in the chat box. ठीक है. Okay, I'm continuing this class. Okay, sorry for this delay. Okay, so we was talking about this food poisoning. We was talking about this food poisoning that is from the same cafe, that cafe, and that is from the point exposure. It means it is the point of the time. At the point of the time only, it is having a cases of it, right? It is having very good. Okay, right. So at the point of the time, we are having a rising of the cases. The sudden rise of the cases will be seen from that cafe. The patient is having the food poisoning, and after that you can see there will be the sudden fall will be also seen. There will be the sudden fall will be also seen from the area, right? So this is about the common source point exposure of the cases. Very good, guys. You are answering in the chat box that go this is the Bhopal gas tragedy. The Bhopal gas tragedy will be there. हिंदी थोड़ा यूज ज्यादा करो सर प्लीज बिकॉज ज्यादा रिकॉल होता है. ठीक है, आई विल यूज द हिंदी ऑल्सो ना. हिंदी में भी पढ़ेंगे, नो इश्यूज. आई एम यूजिंग द इंग्लिश है ना, मिक्स में यूज कर रहे अपन बिकॉज द क्राउड इज ऑल फ्रॉम द हिंदी ऑल्सो अंडरस्टैंडेबल ऑल्सो एंड इंग्लिश ऑल्सो. ठीक है, नो इश्यूज. विल यूज बोथ लैंग्वेज. ठीक है, I will explain in the both language. So the Bhopal gas tragedy, you can understand that was a common source. From a one source will be the tragedy will be there. The gas leak was from there, and it is having the point of the exposure will be there. At the same time, the point of the exposure will be there, and all the cases were in a sudden rising, rapidly rise and the rapidly fall in these cases, right? So this is about your common source point exposure. If I'm talking about for the next is the common source and continuous exposure, which is your secondary, right? Common source and the common source and the continuous exposure. So in this cases, you can see by the diagram only, you can see in the diagram that it is starting slowly, slowly, having a wave of it, rising, and again down, again rising, then again fall, rise, fall are going to seen here. It means it is having a waves in it. So it is causing by the, it is causing the wave occur, it is creating the waves. You can see there is the waves are there, and you can see this is from the contaminated wall, this is from the contaminated wall. Right, contaminated wall, some a wall is there, a well is there which is having the contaminated with the right, and the common source is used by the village. That village is using the same well for the drinking the water, the same contaminated well is used for it, right? And you guys can understand there will be the common source, the source is common now, the well is the common now, and it will be continuously going to expose the patient. This is in the second, so the exposure will be continuously, it will be rising, then falling, rising, falling, rising, falling. There will be the waves will be seen in there. Very good, right? There will be the waves will be seen. Very good. The HIV HIV positive sex worker also you can see in this common source continuous exposure, right? And now the next one, please remember the image base also. This is the images which you have to remember. Maybe directly they can ask you with this images. Remember, this is the image based questions, right? So you can see the chart for the chart of the common source point exposure in all the cases. You can see this is the risely, this is the having the one wave only, right? Rapid rise, rapid fall. But the second one, you can see in this image, you can see there is the waves are given. There's the common source from the same source only, it is having the commonly source, but it is having the making the waves. The next one and the last one, we having the propagated epidemic. The next we having the propagated epidemic. This, the propagated epidemics, having the per person transmission, the person to person the transmission will be seen there. The person can transmit it to the person, the disease, like person to person transmission, and having the explosively epidemics like just recently there was a COVID-19 and the SARS pandemics. The COVID-19 and the SARS pandemics will be seen, and what will be in the scene in these cases, guys, you can understand now. You can understand now there will be the scene of the normal cases while going on. The sudden peak was seen, then again drop was seen, then again peak will be coming, and again drop will be coming, again peaks will be coming. So in this, there will be the peaks will be seen. There will be the peaks will be seen, and please remember this will be the person to person, not because if I'm talking about the contaminated wall, that was a common source. So from that source only, there was a different person is continuously getting exposed to that sources. But if I'm talking about to this propagated epidemics, please remember this will be having the person to person. It is having the person to person. Like in the in the 90s, there was a TB, plague was there, right? So these were the propagated epidemics. These were the propagated epidemics, right? Okay. Of course, the PDF, I already told you the PDF will be getting link. The link of the PDF I will post in the comment box in the description of this video, right? Of course, the PDF will be given to you, and on the exam morning day, you can directly scroll this PDF, and it will be all the PSM revision will be there in a quick manner. It will help you to increase score in your part 1 exam in your FMG exam. Okay, doctor? Right? So please remember the graph of this propagated epidemic. You have to remember this is having the certain peaks will be seen in there, and there will be the person to person. Please remember that in the propagated epidemic, there will be the person to person will be transmission, or the explosively epidemics will be seen. Understand? Now I am moving forward. Now I am moving forward for the next thing, right? Related to this related to this common source and all, we are talking about the reservoir. What is the reservoir? Please let understand this thing, right? Understand this thing, right? There will be the, yeah, pandemic and epidemic, endemic, these are the all the different, na? Pandemic, the all the worldwide will be there, right? Epidemic in some countries, endemic in a some area only, specific area mein hoga disease. Understand? So endemic chota, then epidemic, okay, then pandemic is the like COVID worldwide tha, theek hai? Talking about this reservoir, talking about this reservoir, what is the reservoir? This is the natural habit. habitat, right? These are the natural habitat. And the talking about the sources, please understand, these are sources. What is the mean by the sources? From where the infection transmitted to others. The infection, it means the source, एक ऐसा source होगा from where the infection is getting transmitted. Like just now only I told you what was the contaminated well. Contaminated well was the source. From there, this on the all the villagers was using the same well, the same contaminated well, that is getting the infection. They guys are getting the infections, right? And infectious. Okay. And the the HIV positive sex worker, right? That is also the source, right? The person are getting exposed to it, right? The next I'm talking about the primary case. Now understand the primary case. What is the mean by the primary case? The primary case is saying the first case in the community, right? Like you are living in a community and there was a case was positive for the positive for the COVID-19. So that was a primary case. The first case in the community was positive. The first case will be getting in the positive. That will be your primary case. Now after the primary case, we have in the secondary case also. We have the secondary case also. What do you mean understand by the secondary case? The secondary case is giving you the subsequent cases which is arising from the primary case. It means I already told you what is the mean by the primary case. The first person in the community is the first positive person. So now that positive person will transmit the diseases from that person, the other person who are getting infected, who are getting this infections, right? That will be your secondary cases. That will be your secondary cases. The primary case क्या होगा? The first one. Okay. The secondary क्या होंगे? जो first वाला जो primary case था उससे जो लोग infected होंगे, that will be known as your secondary cases. That will be known as your secondary cases. If I am talking about the index case, if I'm talking about the index case, this index case is known as the first observed case. The first observed case is your index case. The first observed case is your index case. Talking about the serial interval, important the PYQ hai, right? This is a very important, and the PYQ also mentioning here PYQ. What is your serial interval? The serial interval, the time between the primary and the secondary cases. It means the primary case was diagnosed now, and from this primary cases, what was the transmission was there to the secondary cases, other cases. So primary was diagnosed till the secondary will be getting diagnosed this time. जो time होगा तो primary तो पहले हमने diagnose कर दिया है ना. So from there till the secondary will be diagnosed. The second उससे जो infected लोग हुए हैं that will be diagnosed. So this time, so time will be getting this time between the primary cases and the secondary cases. This will be known as, this time point will be known as your serial interval. This time will be known as your serial interval. Understand? Talking about the next about the cases, talking about the next about the cases, the cases, it means the infected person who will shows you the sign and symptom, right? The person who will show you the sign and the symptoms, that will be your case. That will be known as your case. If talking about the subclinical case, now, this is a very important thing. What do you mean understand by the subclinical case? The person who is infected but does not show the sign and symptom. It means the patient is having the disease. Okay, the patient is having the disease, but he is not showing you the sign and the symptoms of the disease. It means the patient is infected, but it will not show you the sign and symptom. If it is not showing you the sign and symptom, that is known as your subclinical case. That is known as your subclinical case. It means the clinical symptoms are not there. It means below the, this case is the below the clinical cases, right? So this is known as your subclinical case. This is known as your subclinical case. Now I'm talking about the carrier stage. What do you mean understand by the carrier stage? And this is the, this in this there is an individual who is infected. There is the individual who is infected does not show the sign and symptom. Now you guys ask me, sir, it is the same, the subclinical case, the carrier and the subclinical case is the same only. The person is not showing the sign and symptom is known as your subclinical case, and just now you are saying the same only, that the in the carrier stage also, in the carrier stage also the patient is infected but not show the sign and symptom. Just remember this, the carrier stage is able to transmit the number of quant morbidity, years, and the life granted disease. It means your subclinical case is cannot transmit it. वो transmit नहीं करेगा disease को ना. The person is infected, but it cannot transmit the disease. So transmission will be not there. Sign and symptom उसमें भी नहीं होंगे. And in the carrier stage also, there will be the no sign and symptom. There will be the no sign, no symptom will be there, but this carrier stage can be transmitted to the others. Okay, this carrier stage will be transmitted to the others person, right? Moving forward for the next, for the incubation period. Talking about the incubation period, what do you mean by the incubation period? This is the time it was between the entry of the organism and starts the showing the first sign and symptom. It means this incubation period is showing the organism is entered into the body. After the enter to the body, it is causing the first sign and the symptom. This is known as your incubation period. This is known as your incubation period, right? So incubation period का मतलब क्या है? That bacteria, virus or the organism is entering into the body, and showing the first sign and symptom is known. It's known as the incubation period. The next is the after the incubation period, we have the generation time. What we have the generation time. What do you mean understand by the generation time? This generation time is the time between the entry of the organism and the maximum, please remember, the maximum communicability of the causative organism or the causative the agent. So it means the incubation period, the first sign entering the body, the organism enter into the body and the showing the first sign, it is your it is your incubation period. But talking about the generation time, this time between the body, the organism enter into the body till the maximum communicable communicability of the causative agent, it is known as your generation time. It is known as your generation time. The next thing I'm talking about, the isolation. I hope this thing you already know from your COVID-19, right? The recent pandemic was there. So this done for the diseases, this done for the diseases people for the maximum communicable period, right? So what was the COVID in the COVID, what was the maximum communicable time? What was the communicable time? Maximum 14 days. So what we was doing, we are making the isolation for the patients, है ना? Isolate कर रहे थे, उनको अलग रख रहे थे हम लोग, है ना? So for the maximum communicable period, right? जितना maximum था, 14 days was the maximum communicable period. So we was making of it, right? And the next is your quarantine. Isolation is different, quarantine is different. The quarantine is saying for the applicable for the healthy people, it is for the apparently for the healthy people for the maximum incubation period. It means the patient is, if the patient is positive for the COVID and you are making it different, in making in a different room और उसको different space पे रख रहे हैं, तो उसको बोलेंगे हम isolation, right? But quarantine क्या था? You all guys was studying in a foreign countries at the time of the COVID. You back to India with the Vande Bharat mission, right? And after when you are landing to the airport, Delhi and various airports, right? And what was there? There was a quarantine was there. Quarantine was there. At that time, when you landed on the airport, you was positive for the COVID-19? No, you was not the positive for the COVID-19. But you are apparently healthy was there, healthy people was there. But for the maximum incubation period, for the 14 days, they did you the they did you the isolate, they did you the quarantine for the 14 days. If there is a sign and symptom was there, seen was there, it means you have the disease. So there was apparently people will be the normal, healthy people will be there, right? In this cases you will be healthy, but you will be separated from the community, right? Separated from the community for this only, okay? For the for the maximum incubation period, right? So this is about your quarantine. And what about the isolation? Just please remember about the isolation, the patient is having the diseases, okay? So covid जिसको हुआ, जैसे covid positive tested हुआ, we given the isolation, हमने क्या कर दिया, उसको isolate कर दिया patient को for the isolation, for the maximum the communicable period, for the maximally the communicable period. So this is difference between the isolation and the quarantine. Please understand it, okay? Now I'm starting with the next topic, which is about your diseases part, which is the communicable diseases, right? Now I'm starting with the communicable diseases. In this part, little I will be having the little bit increasing my speed because these are you already studied in your pediatrics and other subject medicine subject. So I'm trying to cover in a very faster manner. Please understand. Okay, so increasing my speed and try to cooperate with me. Starting with this the chicken pox is having the period of communicability is from the 1 to 2 days before the rash and the 4 to 5 days after the onset of the rash. It means when the rash will be going to appear, just before the rash, only 1 to 2 days, it is can be communicable, and till the after the rash, after the appearing of the rash, 4 to 5 days of this. If you're talking about the incubation period, just now only I told you what is the incubation period, right? So the incubation period of it is from the 10 to 21 days. The commonly, if I'm taking about the range of it, it will be your 14 to 16 days of the incubation period. What is the transmission of the chicken pox? Please remember, the chicken pox is transmitted by the airborne. This is the airborne disease. This is the airborne disease. If we're talking about the most common age group, this will be the less than 10 year of the age group. It will be more affected by with the chicken pox, more affected with the chicken pox. If we're talking about the sign and symptom, there will be the pleomorphic, symmetrical, vesicular rash will be seen, right? There will be the vesicular rash will be seen, which is going to start from the trunk area. So it will be starting the centrally, it starting from the trunk only, right? So there will be the, please remember, there will be pleomorphic, symmetric. There will be the symmetrical vesicular will be seen, right? Vesicular rash will be, these are the vesicles will be seen on the small vesicles will be here, right? So these are the vesicular rash will be seen here, right? And this will be, there will be the scab, there will be the scab on the rash are not infective. There is a scab on the scabs on the rash. There will be the not infective. And please remember the pneumonia related. Please remember the pneumonia related to this. That shows in the iceberg phenomena, right? This will be showing the iceberg phenomena. If we're talking about the diagnosis, how we'll be making the diagnosis? The diagnosis will be making the clinically or the varicella zoster virus RT-PCR. We can do the varicella virus zoster RT-PCR. Understand? So this is about the diagnosis part. Clinically diagnose कर सकते हैं. There will be the age will be less than the 10 year of it. There will be the pleomorphic symmetrical vesicular rash will be seen started from the trunk only, and this will be your this will be your signs. You can see this is the image of your chicken pox. This will be the image of the chicken pox. Please remember, this the vaccine is available for the chicken pox, which is having the OCA stain. Please remember the stain, name of the stain. This is the OCA stain, OKA, OCA stain for the chicken pox, right? And this is the live attenuated virus. This is the live attenuated vaccine. This is the live attenuated vaccine, which is having the 2 doses of the vaccine should be given in this case. There will the 2 vaccines should be given, right? So this is about the chicken pox. This is all about the chicken pox. Now we are moving forward for the next disease. This next disease is about the measles. We are talking about the next disease. This is about the measles, and this is having the period of communicability of the 4 days before the rash and after the onset of the rash. The 4 days before the rash and the 4 days after of the rash. So this is having the period of communicability. If you're talking about the incubation period of this, the incubation period is from the 10 to 14 days in the developing countries. If you're talking about the incubation period, this is the 10 to 14 days in the developing country. Talking about the airborne, please remember the transmission is transmitter. How this disease is transmitted? This transmission should be the airborne, airborne, right? And airborne, right? If you're talking about the most common age, it will be seen the less than 15 year of the age. Please remember, this will be seen in the less than age of the 15. Measles will be seen the less than age of 15 years of it. But if you're talking about the most common age, this will be the 6 months to 3 years. This will be the 6 months to 3 years will be the most commonly age where the patient will be getting diagnosed. What will be the sign and symptom? The rash will be started from the face. Please remember, and the same thing you will ask me, sir, rash was seen in the in the chicken pox also, but it was starting from the trunk. But if the rash is starting from the face, that will be the, we can diagnose the clinically that this is the measles, right? And there will the mild sign and symptoms will be seen like the Koplik spot. Remember this. This is the IBQ. Please check the Koplik spot in your pediatric subject. I hope you remember the measles, the Koplik spot, and the morphiblom rash starting from the face, especially it's starting from the behind the ears. So the first will be seen from the behind the ears. This will be the most commonly associated with the features of diarrhea and the malnutrition. This will be seen in the malnutrition. There will be the severe in the cases of malnutrition. This will be seen in the, if the severity will be seen in the malnutrition cases. The most common complication will be otitis media, right? From the ENT subject, I hope you remember the otitis media, right? So then the measles, the most common complication of the measles is your otitis media. If we're talking about the most common cause of death is your pneumonia. The most common cause of death is your pneumonia. This is your pneumonia. If we're talking about this is having a long term and the rare shifts and drift, right? This is having the long term and it is having the rare shifts and drift. If we're talking about the vaccine, this is having the measles vaccine. We already talked about it. This is the live attenuated vaccine. This is having the live attenuated vaccine, and we also having the measles immunoglobulins also. This will be used in the within the 3 to 4 days of the exposure, followed by the vaccine the 8 to 12 weeks later also, right? We cannot give this vaccine when the disease is ongoing, so we can give within a 3 to 4 days of the exposure. Just the exposure is seen, right? After the 4 days rest will be seen. So after the rest will not give this vaccine, will give later, then will give this vaccine later in that 8 to 12 weeks later, right? We'll follow this 8 to 12 weeks later, right? So this is all about your measles. This is your image of the measles. You can see here, this is the rashes will be seen in your measles, right? This will be the rash. If we're talking about the rash, how it will be different from the your chicken pox, that will be the vesicular rash. This will be your vesicular rash. Talking about the next disease is about your rubella. Talking about the rubella, this is having a mild disease and the self-limiting disease, right? This is having a mild disease and also it is the self-limiting. This is a self-limiting disease. And talking about it, this is having a clinical and the subclinical cases are seen here. And this shows, please remember, this disease shows you the iceberg phenomena. This disease will be showing you the iceberg phenomena. If we're talking about the period of communicability, this is the 7 days before and the after of the rash, right? So 7 days before of the rest, after the 7 days after of the rest. Incubation period will be your 40 and 14 to 21 days will be the incubation period. And if we're talking about the mode of transmission, will be here your droplets. This will be transmitting from your droplets. This will be transmitting from your droplet. If we're talking about the most commonly, this will be seen in the winters, spring. It will be seen in the winters and the spring. And important thing, this is having the epidemics in a 4 to 9 years. Every 4 to 9 years, it is having in the epidemics. It is causing the epidemics. The most common age of involvement in the developing countries is the more than 15 years. More than 15 years of the age. Sign and symptoms. If we're talking about the sign and symptom, the rash start from the face and if and mildly will be seen. If we're talking about the complication will be seen the congenital rubella syndrome in the early pregnancy infections, right? So in the early pregnancy infections, it will be causing the congenital rubella syndrome. I hope you studied this syndrome in your pediatric subject, right? And if you're talking about the vaccine, this is having a vaccine of live attenuated virus, and already I told you this stain is your the stain was RA273 RA27/3, right? And please remember this, avoid pregnancy for 1 month after the taking of rubella vaccine. If the patient has had the vaccine of the rubella, so please try to avoid the pregnancy for the next 1 month, right? Because it can cause you the congenital rubella syndrome in the early pregnancy, right? Now moving forward for the next disease, it's about your influenza. Talking about the influenza, this is the epidemic. This is having the epidemics and with the serotype of A and B. The A and B, type A and B serotype is causing influenza, type is A and B is causing the epidemics, and H and N antigen is related to the shifts and drifts. The H and antigen is causing you the shifts and drift. And please remember the period of communicability is the 1 to 2 days before and after of the onset, right? 1 to 2 days before and after of the onset. And incubation period is here 1 to 3 days. The incubation period is just here 1 to 3 days. Talking about the transmission should be seen here droplets and the airborne. As this is the by the influenza virus, so the antiviral drug should be given. So the drug of choice is the all seltamavir. The all seltamavir will be given in the cases of influenza, right? So you can see the symptoms of the influenza: fever, muscle ache, chills will be seen, right? Cough will be seen, and weakness will be seen. Diarrhea will be seen there, right? Vomiting, headache, this all will be seen in the influenza. Moving forward, for the next is for the mumps. Starting with the mumps. In the mumps, you can see these are having the clinical, and it is having the clinical and the subclinical cases. Period of communicability is 4 to 6 days before and after, right? Before and after. Before and after. Okay, before and after, and the 7 days after onset of the rash. Before and the 7 days after of the rash. Please remember, right? So this is the period of communicability is 4 to 6 days before the rash and the 7 days after the onset of the rash. If you're talking about the incubation period, it is having the 2 to 4 week of the this is having the incubation period. This transmission will be done by the mumps from the droplets. This is transmitted from the droplets. The most common age will be here 5 to 9 years will be the most common age. If we're talking about the sign and symptom, the 30 to 40% are the subclinical cases in with the earache, parotitis will be seen in this cases in the 30 to 40%. But the most common complication you have to remember, this is your PYQ. This will be your orchitis in the adult children, right? Meningitis and the ovaritis. You have to remember this is your PYQ. Orchitis was asked in your PYQ, right? The complication of your mumps was asked. If you're talking about the vaccine, there is the vaccine of the mumps is your Zerlin is the your Zerlin is your stain, and this is your live attenuated vaccine. This is your mumps. For the mumps also we have the live attenuated vaccine. Talking about the next disease is about your diphtheria. Talking about the next disease is about your diphtheria. In the diphtheria, please remember this is the most common. This is the most common in the age of 1 to 5 years of the age. This will be seen in the most in the 1 to 5 year of the age. And remember, the transmission should be from the droplet and the healthy carriers. Some healthy carriers are also having here, which is carrying this diphtheria and causing the diphtheриal disease. Incubation period is 2 to 6 days, and the cases are seen in the subclinical cases and in the carrier stages also. Talking about the treatment for the cases, if we're talking about the treatment of the cases, we can do, there will be the diphtheриal antitoxin, which is the erythromycin and the penicillin, which we are having the erythromycin and the penicillin. But there is a treatment for the carrier also, the carrier stages also. So we can give the 10 days, we can give the 10 days oral erythromycin should be given to the carrier cases, given to the carrier cases. If we're talking about the management of the contents, right? So the management of the contents, there will be the context will be there. If completed vaccine within a 5 years, there will be the no need of the vaccines will be given. And if there will be more than 5 years ago and the full 3 dose was given, so just give one booster dose should be given in these cases. And if there will be less than 3 dose or the unknown cases will be there, please do the complete the primary doses again. And please remember the isolation till the throat two negative throat cultures should be given 224 in the 24 aparts. And you can see this is the image of your diphtheria, and this is in the ENT. I hope you remember this is the membrane of the diphtheria. This is the membrane of the diphtheria. You can see this is the diphtherial membrane should be seen to you, right? So this is about your cases of diphtheria. Talking about the next case, this is about the rabies. Rabies is also important. Please remember there are the three classes are seen in the rabies cases. Please remember the class 1 is saying that dog is just licked, touched on the skin, right? There will be the and there will a wound will be there, because the with the lick or with the touch of the skin, there will be the blood should be seen there. Okay, if there is a no blood, You cannot. So in the class 1 also, with the no blood also, you can see the licks. In the licks there will be the no blood will be seen there. So in the licks and the touch on the skin, there will be just, you have to do the wound management, just you have to do the wound management. In the class 2, if there is a lacerations are seen, abrasions are seen, the blood is seen on the wound, you have to do the wound management, plus you have to give the anti-rabies vaccine. You have to give the anti-rabies vaccine should be given. If we're talking about the class 3, the class 3, there will be the deep wounds will be there, and there will be licks on the mucosal membrane, right? Or the bleeding wounds are seen there. The bleeding wounds are seen there. You have to manage the wound. You have to give the rabies vaccine also, and you have to give the rabies immunoglobulins also. You have to give the rabies immunoglobulins also. So now in the delayed and the loose structures, or you have to do the wash for the continuously 10 to 15 minutes in the running water, plus soap you can use in the cases. Talking about here the cases having the post exposure prophylaxis, like the patient is had this by the dog bite, right? So the post exposure, after the exposure, so you have to use the ascent regimen. You can use in this ascent regimen, you have to give the 5 doses, right? 5 doses, and should be the 5 visits. The day 0 1 first dose, day 3rd, day 7th, day 14th, and day 21 should be given the doses. And the intramuscularly 5 visits and the 5 doses should be given by the ASIN regimen. ASIN regimen is saying 5 doses, 5 doses, 5 visits should be done. In the Thai regimen, if you're talking about the Thai regimen is saying there will be the intradermal 4 visits. There will be the 4 visits, and the 8 doses will be given. It means on the both of the side will be the intradermally, on the intramuscular acid remission is giving 5 visits, 5 doses will be given on a one side only of the forearm, right? On the arm, sorry, right? On the arm. But this Thai regimen is saying on the both side of the arm, you have to give the intradermally. In the 4 visits, you give 1 dose here, 1 dose here. So it will be giving you the 4 visits in the on the day 0, 3, 7, and 28. 0, 3, 7, and 28, right? This is about the post exposure. This is about the post exposure. It means there is a dog bite is there, risk factor is presented there. So this is the post exposure. But now I'm talking about the pre exposure prophylaxis. What is the pre exposure? Before the dog bite only. Who guys are having the dog lovers or having the dogs in the house, they have to take the pre-exposure prophylaxis. They have to take the pre-exposure prophylaxis on the day 0. They have to take the day 0, 7, 21, and the 28th, right? After this, they can take the 3 doses, like 0 and 7, he should have to take 21 and 28, he can take any dose of it. And please remember, it should be on a one side, and the intramuscularly or the intradermal should be given. This will be given the intradermally or the intra intra muscularly will be given. The next, you have the re-exposure prophylaxis. What do you mean by the re-exposure? You had earlier, you had a exposure to the dog bite and you had the vaccines completed, but now again you get the re-exposed. Again the dog bite will be there. In this cases, just you have, if you completed the earlier one, please remember in the post exposure, in the early one, post exposure, you took all the 5 doses as per the SN regimen, or as per the Thai regimen, all the 8 doses, right? 5 doses and 8 doses were done. So now you just have to take in the day 0 and day 3, just you have to take 2 visits, and the 2 doses should be given. In this cases, in the re-exposure, just 2 doses will be more than enough. In these 2 doses, the first site will be given, intramuscularly will be given, or the intradermal should be given. And please remember to given the all the pre-exposure and the post are the more than 3 months ago. ठीक है? So the re-exposure कब होना चाहिए? जो post exposure और the pre-exposure doses जो आपने लिए थे, that should be done before 3 months ago, then the more than 3 months ago. So this is all about the rabies. This is all about the rabies. And with this, we have the important rabies immunoglobulins also. We have the rabies immunoglobulins also. So in the rabies immunoglobulins, we have the two type of rabies immunoglobulins. We have the human rabies immunoglobulins. We have the equine immunoglobulins, right? But please remember, they're having the different dose. So you have to remember the 20 international unit per kg is human human rabies immunoglobulins are given, and the 40 international unit per kg is your equine rabies immunoglobulin should be given. The maximum, the maximum to be infiltrated in wound, the maximum to be infiltrated in the wound in the nearest intramuscular site, in the nearest intramuscular site should be given, and not, this will be the not given in the pre-exposure or the re-exposure regimen. Please remember, this is just after the post-exposure only. This rabies immunoglobulin is just given in the post-exposure only. This is not given in the pre-exposure or in the re-exposure regimen. Understand? This is all about your rabies immunoglobulins. The next I'm talking about the yellow fever. Next I'm going to talk about the yellow fever. You already know this is the vector is the Aedes aegypti, and once the infected person is infected infected in infection in all life, this is having only the one infection, and the period of communicability is the first 3 to 4 days of the illness is the period of communicability, and incubation period is your 3 to 6 days. 3 to 6 days is the incubation period. The vaccine strain is your 17D vaccine, which is your live attenuated vaccine, and it is having contraindications. This vaccine is contraindication in the person who having the ag allergies. Who person is having the ag allergies, right? The vaccine is valid from after the vaccination the 10 days for the lifetime. So जैसे ही उस vaccination हुआ है उसके 10 days बाद ये valid होगा, है ना? Before in this period it will be not validate, right? So जैसे कि मैंने आज vaccine ले लिया, the today is the date of the 18th January. So it will be validate from the my 28th January के बाद ये valid हो जाएगा. This 10 days will be the period. After this 10 days till the lifelong, this yellow fever vaccine will be validated, right? So this is about your yellow fever. This now I'm going to talk about the important things about the our BMW, biomedical waste management, right? I will talk about the biomedical waste management, and we'll talk about the some important, sorry, I will talk about the STD kits. These are the STD kits. I must forget about it. This is the STI or the STD kits, the sexually transmitted infections kits, and we'll talk about the leprosy and talking about the biomedical waste management, right? Just before talking about it, then we'll further going further for the images, right? Important images will be also covered in this session only related to the related to your all the PSM related MCQs. Just here, I'm taking a break. Now there is the 4 o'clock, right? Till the 4:10, I will be back here. Just 10-minute break is here. After the 10-minute breaks, please be live. After this session we already covered the most of the important part. Just now we have to summarize the all the important images, because this PSM subject is having more and more weightage of the images also. Out of this 33 MCQs, minimum 6 to 7 images should be expected. 6 to 7 images to be expected from your PSM subject. So just after this break of 10 minutes, I will be back here and I will be going to talk about the all the important images. I will be going to talk about your all the important images, right? So just 10 minutes break, and we will be I will be back here and will continue the class, right guys? Okay, just 10 minutes. Okay, this is the sharp 4 o'clock. On the 4:10 will be again back here. Okay, right? Guys, am I audible and clearly visible to you? Let me know in the chat box. Let me know in the chat box. Am I clearly audible and visible? Doctor is asking vitamins so good. Doctor, I am not covering the vitamins in this PSM part because I know you already covered the vitamins very well in your biochemistry, right? You detailed all the details related detailed vitamins you studied in the biochemistry. So I am not covering the here, right? Is it okay? Is it okay now? Let me know in the chat box. Let me know in the chat box. Audio, video, perfect. Okay, okay. Let's continue the class. And now I'm going to cover the all the important images in a quick manner, right? Please understand this all the things in a very quick thing. Starting with this, first, it is your STI kits, right? And this is your RTI syndromic case management. We're having the we having the importantly our six type of our six type of the case our kits, like seven type of the cases kits, sorry, seven type of the kits, right. Starting with the first one, which is your gray kit. This is the gray kit, the kit one, which is your gray kit. And in this gray kit you have to use in the urethral discharge, right, vaginal discharge, and there will be the pus will be in your urine. So this gray kit will be used. What is the consisting of this gray kit? Please understand this consisting of the this will be consisting of erythromycin 1 gram and the cefaxime 400 gram will be covered here, right? So this will be covered in this gray kit. The next we having, this is, remember please, for the urinal discharge and the cervical discharge will be used. The next about the vaginal discharge, we have the green color of the kit. We have the green color of the kit for the vaginal discharge, right? And there we have we have genital ulcers, right? We have the kits for the genital ulcers, right, which are the non-herpetic. For the non-herpetic, we can use the white kit or the blue kit. We can use the white kit, and the blue kit will be used for the genital ulcer, for the genital ulcers, right? For the genital ulcer. And which is the non-herpetic? Please understand, this is the non-herpetic one. If we're talking about the herpetic one, the genital ulcer, which is having the herpetic one, this is used this is used the red color. This is used the red color kit of the used in the herpetic genital ulcer, right? After the genital ulcer, we having the lower abdominal pain. The patient is coming with the lower abdominal pain cases. We have to give the yellow kit. We have to use in the yellow kit. And the last one, which is your inguinal bubo, right? Which is the last one after this STI infection. There is an inguinal bubo will be there. In the inguinal bubo, there will be their black kit will be given. Black kit will be preferred in this STI. So this is the STI kits, right, which you have to remember, right? Okay. So this seven type of the kits you have to remember with the color and the when this will be preferred or when will be given. You have to understand it. Now I am moving forward for the next is about for the leprosy, disease of the leprosy. And for the this leprosy, there is a NLEP, the National Leprosy Elimination Program is going on. The National Leprosy Elimination Program is going on, and in this program we have to give the treatment, which is the multi-drug therapy should be given in the treatment of this leprosy. And if we're talking about this national elimination program, this national leprosy elimination program is having a logo, right? This is the logo of, okay, this is the logo of your NLEP, National Leprosy Elimination Program. So there is the two type of the leprosy there, the paucibacillary, right? Paucibacillary and the multibacillary. What is the paucibacillary? I hope you remember in this paucibacillary, there is a skin lesions will be seen from 1 to 5 skin lesion will be seen there, and you will see there is a nerve involvement of more than 0 or 1. And this is having the stages of the TT and the right tubercular intrusion and the borderline tubercular right? And then we having the drugs will be used here. We are using in the pockybacillary, we are using the dapsone and the rifampicin for the 6 month of the duration. We'll use the 6 month of the duration. The recently only the leprosy recently just updated, the recently update will be here, but please remember that recent update will be not asked to you just now only, because it is just getting updated now. It will be asked in the later part in the FMGs or in the NEET PGs. But in this exam, which is your after the 2 days only you are having the exam, in that cases, please don't read that recent updated class calcification of the treatment for this pockybacillary and the multibacillary. This old one can be asked to you, but not the recented one. Please remember it. Okay. Talking about the multibacillary, there will be the lesion will be more than 5, and there will be nerve involvement will be more than 5. This is having the 3 categories: borderline, borderline, and the borderline then estimation and this LL. The drug will be used here the same with the dapsone, rifampicin, and the here added is the clofazimine. There will be the clofazimine will be added here for the this the duration of it. If you're talking about the duration of it, this duration will be the 12 month. This duration of this multivessel treatment will be the 12 months will be given. This is all about your leprosy. This is all about your leprosy, and please remember the image. This is the logo of National Leprosy Elimination Program. National Leprosy Elimination Program. Now I'm moving forward for the biomedical waste management. What is your biomedical waste, guys? What is your biomedical waste in your hospitals? In the hospitals, whatever the whatever waste is there right out from the hospitals, right, that will be managed in a different manner, not as a normal waste. So this is the biomedical waste, right? So this biomedical waste is we are having the different boxes, or the in the hospitals you are having the different dustbins. So talking about the dustbin is starting with the first one, which is your blue color dustbin. What is the consisting, what you have to put in this blue color dustbin? Please remember the one question always and always coming from this topic. This is your PYT important topic. ठीक है, important topic भी है and PYQ भी है. PYQs भी बहुत सारे आते हैं इस पे, इमेज बेस्ड क्वेश्चंस भी आते हैं, IBQ भी आते हैं. ठीक है, they will show you something and they will ask you in which dustbin you will put in this biomedical waste, right? Starting with the blue color dustbin. In this blue color dustbin, there will be the disposal of the metallic implants, right? Metallic implants like your pacemakers, your orthopedics implants, and your glass wares, like your glass wares. And this will be disposed by the recycle. This will be disposed by the recycle. Like the pacemaker is the instrument, and it is a metallic instrument. The orthopedic nails was there, rods was there. This all will be put in your blue color dustbin, and all the glasswares will be in your blue color dustbin, right? This will be all in your blue color. And what will be done? This will be disposed by the recycling. This will be disposed by the recycling. Moving further for the white color dustbin. In the white color dustbin, you have to put the sharp waste materials, including like needles is there, surgical blades, scalpel. This all should be all the metallic but sharp one. Okay, sharp wale it will be, all the sharp one will be in this. Like, and what will be the management? This will be sent to the iron factories. This will be sent to the iron factories with the landfills or the sharp pits. So what will be do? This surgical blades, needles, scalpels will be, what will be do? They will be doing the shading करके हम इसको क्या कर देंगे, छोटे छोटे small iron particles में divide कर देंगे, and then will then will move this all the material for the iron factories for the again the recycling. So this is about your white color dustbin. Moving forward for your red color dustbin, what will be in your red color dustbin? In your red color dustbin, there will be the recyclable contaminated materials. So recyclable contaminated materials, including the plastic, rubber waste, catheters, cannulas, tubes, and all other important things which can be recycled. Please remember, this is the we are recyclable. Okay, all the plastic will be in this. And what will be used in this? The red color will be sent to the road making, energy recovery, or the fuel oiling. And this will be recycled also. Sometimes this will be the recycle also. First we'll do the recycle and we'll use it again. Okay, so these are about the red color one. The important one, which is your yellow color. The yellow color is the important one. So remember this, The human anatomical waste, which is the animal waste, human anatomical waste, animal waste, and the soiled waste or the microbiological, biotechnical waste, cytotoxic drugs, discarded wasted drugs, chemical waste. This all should be in this, like bad lining, mattress subjected, or the insuration. This will be done in the insuration. And please remember, the placenta will be deep burial at the PHC. Please remember, this will be not the insuration. Placenta at the PSC will be not in the insuration, so there will be the deep burial will be at the PSC level. Just remember the 2 to 3 MCQs, which is the PYQ also. They can ask you. Remember, in the red color one, there will be the urine bag. Okay, यूरिन बैग की अगर मैं बात करूं, so यूरिन बैग कहाँ पे हम डालते हैं? यूरिन बैग will be in your red color one, and if you're talking about the red color, yellow color one, because that should be your blood bag. ठीक है, blood bag should be in your yellow one. Okay, blood bag should be in your yellow one. ठीक है, so just remember about it. Remember about it. Urine bag will be in your red color dustbin, and yellow, in yellow there will be the in yellow here there will be the your blood bag will be there. Urine bag red color box, and blood bag in the yellow color box. Just remember this. And the important thing, there is a black also. They can ask you about the black dustbin also. And the black box, what is this black? This will be the general waste. Okay, general waste. Okay, what is the general waste? Okay, you are eating the food in the hospital, right? And the wrappers of this foods, or the wrappers of needles, and this all the things, right? The polythenes, papers, and all the things. These are the general waste which is generating there. That will be in your black color dustbin. That will be in your black color dustbin, right? So you can see here, all the type of the here you can see this black or the green will be here. There will be the general waste will be there, kitchen waste, paper, tissues, water bottles, and the other things will be in disposed in the green or black. This can be green or black also. Please remember, black also. Okay, black or green same है. ठीक है, black or green same है. This will be for the general waste. This will be for the general waste. ठीक है. And talking about the red one, the all the infected plastics, syringe, gloves, and the plastic wastage will be in the red color one. Infected wastes like soiled anatomical waste, chemical, liquid, cytotoxic, laboratory wastage, this will be in your yellow one. And please remember all the glassware. Please remember the all the glassware and the metallic implants will be here, right? All the antibiotic vials, vial will be there. Vial is a glassware. Okay, so glass will be here. All the glass material, metallic will be here. Just remember, here will be the not the cytotoxic. Cytotoxic glassware will be not here. The cytotoxic will be in your yellow one. The cytotoxic will be in your yellow one. The last one will be your white one, where will be your needles and the cut the needles and the cut glasses. Sharps materials will be there. Blades, needles, scalpels will be put it into your white one. In your white one. This is the important image. Please remember. Please remember this for the your upcoming FMG exam. Please remember for the upcoming FMG exam. Moving further now, right? Again, I'm reminding you, you can contact me directly on my Instagram if you have any queries related to the all the subjects of the rapid revision which I took here, right? You can contact me, or for the any other further information, you can directly contact me on my Telegram. My Telegram username is also the Dr. Vaibhav Ahuja, right? So the same on the Instagram, same on the Telegram also, right? Now moving forward for the next images part, please try to cover the images in a very faster manner. This is the logo. I'm covering the all the logos. This is the logo logo of health. This is the National Health Mission 2030. This is the logo of National Health Mission 2030. So what was this? This is including the all the national programs, all India, like RMCH and VVPI, and all the missions are under in this National Health Mission. And the major targets of this national mission was the MMR maternal mortality rate will be less than 100, and that should be there. And infant mortality rate should be less than 25 by the thousand, and the TFR should be 2.1, right? Total fertility rate should be here 2.1. This is the major target was from this National Health Mission. This was from the National Health Mission. Please remember, you can see in this logo National Health Mission will be written with the red color. This is the one boy will be there, the child will be there, and the female will be there, and one son will be on the background. This is the your Rashtriya Swasthya Mission, Rashtriya Swasthya Mission, which is your National Health Mission 2013. The next logo is here for your uh, Ayushman Bharat program is in the 2018, which is also known as, which is Ayushman Bharat, also known as Pradhan Mantri Jan Arogya Yojana, PMJ. Please remember Pradhan Mantri Jan Arogya Yojana, PMJ, right? Short form PMJ, and also known as the Ayushman Bharat. You can identify the logo. There is the 5 leaves are there. The 5 leaves are there in this logo, and this is the Pradhan Mantri Jan Jan Arogya Yojana. This provide you the 5 lakh. Please remember this provide you the 5 lakh per family per annum for the secondary and the tertiary care across the public, private implant hospitals also, and cover the 50 crore population in BPL. This is more than 50 crore of the people population are covered here in this. And please remember 1.5 lakh health and wellness centers will be established in this Ayushman Bharat program, in this Ayushman Bharat program, right? The next thing, this is the logo of national, this is the National Tuberculosis Elimination Program. This is the logo of here. You can see here the one one man is here, and lungs is shown importantly here. There will be shown of the lungs will be shown in this logo, and written here the TB Mukt Bharat. There is the tricolor will be there. In this tricolor there is the written TB Mukt Bharat, and the quote was given, TB harega desh jeetega. TB harega desh jeetega was the quote was given from the this logo. And this is the new name of the revised National Tuberculosis Controlled Program. The last one was the, this is the revised from the National Tuberculosis Control Program. The earlier we was controlling the TB. Now we are at the stage of national elimination of the elimination of the program. In this case, there is a category 1 and the category 2 drugs are will be given, and the same regimen as the HRZD you already know for the 2 months, and the HRE for the upcoming 4 months as the continuous phase will be given, right? The same was the earlier one. The next, now this is the dots pura course. This is the having a quote of pura course pakka ilaj. This is having the pura course pakka ilaj, and this is the logo of dots. ठीक है, बीच में dots लिखा हुआ होगा, right? And this is the direct what is the dots? This is the directly observed treatment short course. This is the dots. This is the based on the, this is the based on the ADAIR support of the DOTS 99, and this is the intensive. The patients is the giving the patients to the 500 rupees of the month. This is the having the giving the intensively for the patient for the 500 rupees for the month, and there will be the chest X-ray and the CBNR test in the diagnosis. The early regimen was fixed dose combination will be given, and active case filling will be done here, and the drug resistant treatment should be given in this dots, right? Moving forward, the next one, this is your निक्षय. Please remember हमने बात करी थी in the earlier part निश्चय. The निश्चय was निश्चय, चय was, please remember C, यहाँ पे निक्षय है, ठीक है? The निश्चय was a home based pregnancy test kit which is provided by the government. The Nikshay is an online tool for the monitoring and the surveillance of the TB control. The TB control program, which is the online surveillance, है ना? And this is having the word of the both the two from the Hindi, Nikshay, right? Nikshay. And please remember this having the two words Nik and Kshay. This is the meaning of the eradication of tuberculosis. This is the meaning of the eradication of tuberculosis. Please remember the logo. Please remember the logo of it. This is the important, okay? Logo याद रखना है, ठीक है? About the Nikshay. Moving forward for the next, this is about the ICD, which is your Integrated Child Development Services 1975, and this is the logo of it. You can see this is the one mother is there, and it is having a child in the in this logo, having a child here, right? And this is the heart of ICDs is the Anganwadi. If they are asking you what is the heart of ICDs, right? Integrated Child Development Services. This is the Anganwadi. This is the incoming into the Ministry of Women and the Child Development in the Government of India. The functional unit of it's the community development blocks, and one community development block is having 100 villages, right? 1 lakh population will be covered in there, and the one Anganwadi center will be covered at the 300 to 800 peoples in the hilly area, and the 400 to 800 population in the plain area. 300 to 800 population in hilly area, and the 400 to 800 population in the plain areas, right? The next we have the three instruments. You can see this is the infantometer. This is the infantometer. This is used to measure the length up to the 2 years of the age of the babies. This is the infantometer. After the infantometer, we have the settle scales. This is used to measure the weight in in the ICD's activity, right? In the ICD's activities, weight measure ke liye, you can see this is having a strap and this is having a dial here, and it is giving you the weight. The next and the important, please remember about this. This is your PYQ. This is your PYQ, or you can say the IBQ. Image-based question is asked. This is your Shakira tapes. This is your Shakir's tape. What is this? This is used to measure the mid-arm circumflex. This is used to measure the mid-arm circumflex, which is your on the filled by the health workers, and this is used in the age group of 6 months to 5 years. This will be 6 months to the 5 years, and it is having the three areas: green area, yellow, and the red color one. Green, yellow, and the red color one. The severe malnutrition will be seen in the red zone. The severe malnutrition patient will be seen in your red zone, and please remember the mid arm circumflex will be less than 11.5 centimeter will be seen in the red zone. In the red zone, right? Moving forward for the next, we having the ICD's growth charts will be available there. You can see these are the ICD's growth chart, and by using this, we are using assisting the malnutrition. They are using the assisting with the malnutrition. We having the two. There is the URC and the LRC. The URC is for the fifth percentile for the boys and the third percentile for the girls. There are the different. This is for the pink color one for the girls, the blue color one for the boys, right? So this is the having the difference. Then we having the WHO growth charts also will be available. This is the WHO growth chart, which is on the weight for age, right? Which is for the weight for age. Then next we having this instrument. You already know this is the Herpentine caliper. This is the Herpentine caliper. This is used to measure the skin fold thickness. This is used to measure the skin fold thickness, right? This is the Herpentine caliper. The next, Poshan Abhiyan. The next is your Poshan Abhiyan. This Poshan Abhiyan is having the quote of Sahi Poshan Desh Roshan, right? Sahi Poshan Desh Roshan, right? This is the PM's watching scheme for the holistic nourishments, and this PM Poshan, this Poshan Abhiyan is a multi-ministerial coverage in the mission with the vision of assurance to the alternate the malnutrition free by the 2022 under the Ministry of the Women and the Child Development. And although this is the had through the Anganwadi Center, this is run through by the Anganwadi centers, right? The next we have the midday meal scheme. We have the midday meal scheme. This is by the Ministry of Human Resource Development. It is also known as the Ministry of the Education. And this midday meal scheme is given as the half 1/3 of the calories and the 2/3 of the proteins in a daily provided to the patient. Means 100 gram and the 150 gram of the kids primary in the upper primary children's provided to the respectively, right? This midday meal scheme. This is the logo you can see here, right? The next, we having the national family planning programs. We having the national family planning program. This is the logo you can see here. This is the having the quote of Jodi Zimmedar to plan kare parivar, right? So this is the Jodi Zimmedar for the plan kare parivar, and it is having a red color triangle. You can see the male and female is here and having a child, right? Having a child in the logo. The red color triangle will be seen here, right? The next we have the Janani Suraksha Karikram, Janani Sishu Suraksha Karikram. This is having a logo of one mother is there, and it is having carrying a child will be here, and the logo is named by the Janani Suraksha, Janani Shishu Suraksha Karikram. This is the free diagnostic, free drug, free delivery, free diet, free blood transfusion, and the free delivery are the components in this year. The newborn care corner was in the covering in this Suraksha Shishu Suraksha Karikram, and the newborn stabilization unit, special newborn care unit, and the home-based newborn care. Home-based newborn care are the all the uncoming, all the covered in coming into your Janani Suraksha Karikram, into the Janani Sishu Suraksha Karikram. The next we have the National Vector-borne Disease Controlled Program. This is known as your NVBDCP, right? The most common vector borne disease is your malaria, and the most viral, please understand, the most viral vector borne is your dengue, and most agroviral will be also vector borne disease will be also your dengue only. This program is running for the malaria, dengue, filariasis, kala azar, JE, and your C fever, right? Chikungunya fever. And you can see here, this is the family, and this is the mosquito will be above on this, and this is having the Rashtriya Vector Janhit Rog Niyantran Karikram, and BDCP, right? So this is the logo of your National Vector-borne Disease Control Program. Moving further for your National Leprosy Elimination Program, NLP, just now only told you, this is the logo of this scheme, and this is having the now also this is generated like we have the Nikshay for the TB. Nikshay is the online portal for the TB. Also, we got the Niquest for the ICT-based online tracking surveillance for the leprosy patient. For the leprosy patient, this is your multi-drug treatment regimens are there for the pockybacillary and for the multibacillary treatment. So this is the having a drug dose, fixed drug dose packets, right? For the pockybacillary and for the multibacillary also. Moving forward, we are having a NACO. What is the NACO? This is the National AIDS Control Organization. This is having the rule of it and having a red color strip. This is the also for the awareness for the HIV AIDS, and this NACO, this National AIDS Control Program, is established in the 1987. 1987. The first case was in the 1986, seen in the Chennai for the AIDS, and this is looked for the narco to the subunit for the MOFA by the government of India. This is the ART initiated in respective to the CD4 count, and the screening is the easy and better for the ELISA rapid, and the simple test will be given, and this is the integrated test counseling. Please remember, this is the integrated counseling and the testing centers was opened by this by this NACO, right? National AIDS Control Organization. The next we have the Suraksha Clinic. Please remember about the logo of the Suraksha Clinic. We have the white color plus with the red color dot and the red color boundaries. This is about the Suraksha Clinic. This Suraksha Clinic is having the sexual and the reproductive health services. This is having the reproductive health services. As I already told you, there are the 7 type of STD kits or STI kits. This STI kits, okay, this STI kits are available in the 7 type of the kits, and these kits are like gray for the urethral discharge and the cervicitis, the green is for the vaginitis, white for the genital ulcer, blue is also for the genital ulcer, but the non-herpetic one, the red one for the genital ulcer, which is the herpetic one, okay, herpetic one. Okay, the yellow one is for the lower abdominal pain, and the black one for the scrotal swelling or the inguinal bubo, right? Okay, the inguinal bubo, right? This is for the Suraksha Clinic. This is for the Suraksha Clinic. Then we have the Mission Indradhanush. You can see here this Mission Indradhanush having the logo. It is having a rainbow on above, and one child is there with the syringe, and the quote of this Mission Indradhanush is the Be Wise, get your child fully immunized. So it is having including the 100% of the coverage in the for the 11 vaccines, preventable diseasing from the 2020 through the catch-up campaigns are going on, which is the TB, polio, diphtheria, pertussis, tetanus, hepatitis B, measles, rotavirus, and the mumps and rubella, IPV, and the JE is communicating in this all this mission in the Dhanush, right? The next we have the switch. The switch. Please remember this logo of the switch. The switch is written here, and this is having the oral IPV was the trivalent IPV. It means it was having 1, 2, and the 3. 3 valents was there, but now this is the BOVP. It means it is just now bivalent. 1 and 3 is left here only. So this is the program is known as the switch, and this was done at the 25th April 2016. Okay, so this was done at the 25th April 2016, right? And the switch program is now from the trivalent. Earlier was the P1, P2, and P3, but now just left with the P1 and P3, which is your bivalent OPV. Now just only the bivalent OPV is there. Next, we have the VVM. We already covered about the VVM, vaccine vial monitor. This is the vaccine vial monitor. I already told you it is having a circle of it. हम इस बारे में ऑलरेडी बात कर चुके हैं, ठीक है. डार्कर सर्किल and the lighter square is there. It means it is okay, we can use it, good and utilize. If it is also getting little bit darker but it is lighter than the outer circle, it is good, we can use. But when it is getting the same, will not use it. And if it is getting darker than the outer circle, although we are not using it, so use the stage 1 and stage 2, discard the stage 3, and the stage 4 will be discarded from there. The next, we having the cold chain for the vaccines. For the cold chain vaccine, we have this dial thermometer which will be used for there. And we are having the dial thermometer is alcohol stem one. This is also for the temperature maintaining, and this is your ILR, right? Ice line refrigerator. We already talked about it. This is having the maintain the temperature of 2 to 8 degree, and this is located at the PHC. This is located at the PHC. The temperature should be recorded for the twice a day. This is twice a day should be the temperature should be recorded. And I already told you, हम already बात कर चुके हैं. The ice packs, this is about your ice pack, right? This is having the carrying the two vaccine, this is carrying the two vaccine, and this is having the for the sub centers and the village stages. Then we have the vaccine carrier. This is the vaccine carrier. I already told you it is having the 4 ice packs. This is having the 4 ice packs in the air, and the 16 to 20 vaccines should be stored in this. The 16 to 20 vaccines should be stored in. This is also used at the level of sub center and the village, sub center at the village. And next we have the national program of control blindness and the visual impairment. This is about your this. You can see here, this is the red cross is here, and the eye logo, the eyeball logo will be here. This is your this is for your national program for the control of blindness and the visual impairment, right? So what is the blindness? This will be given the definition for the blindness: who is having less than 3 by 60, who is having the vision for the 3 by 60, but after the best possible correction, that will be your your blind person. The most common cause of blindness is the cataract, right? Cataract and the refractive errors. The more is the cataract. Okay, if they're asking the most common cause, the cataract will be there. The prevalence of this 0.6 to 3 to the goals is the less than 0.3, right? Less than 0.3%. There's the vision 2020 India was there, which was having the right to sight initiative to eliminate the cause of avoidable blindness, like in the cataract, right? Cataract, childhood blindness, trachoma, diabetic retinopathy, glaucoma, and the corneal blindness will be done. As the vision center was open, the service center was open, training centers, and we have the apex of the excellence. School, we have on the school, the one teacher should be checking the vision for the 150 students, and the referral vision will be less than 6 by 9. 6 by 9 will be the referral for the referral unit from the school. Next, we have this logo. You can see in the logo is written only the Anemia Mukt Bharat, the Anemia Mukt Bharat 2018, to reduce the prevalence of the anemia by the 3% by every year by the 2022. And this is having a strategy of the 6 beneficiaries, the 6 interventions, the 6 institutional mechanism, right? So this is having the scheme of 6 is equal to 6 is equal to 6 by the Anemia Mukt Bharat. Anemia Mukt Bharat. The next we having the national program of the prevention and the control of diabetes and the cardiovascular diseases and the stroke, right? So you can see here, this is the logo, and this is having the health is in your hand. This is having the quote of health is in your hand. आपकी सेहत आपके हाथ, ठीक है? आपकी सेहत आपके हाथ. So this is the logo of your national program of prevention and control of diabetes and the cardiovascular diseases, right? The next, moving forward for the next, this is having the rule of half. This is having the rule of half, which is shown by the hypertension, which is shown by the hypertension community. You can see this is the whole community, the bigger one, and after this whole community, the half of the person is having the hypertensive hypertensive subject. This is having the hypertensive subject, and after this hypertensive subject, the 50%, half of this are the diagnosed as the hypertensive, the half of it are the diagnosed as the hypertensive. And after the half of the diagnosed person, they will get in the treatment, and the half of will be the getting adequately treatment. So this is the rule of half, which is shown by your hypertension. This pink color ribbon, will be the awareness for the breast cancer. The awareness for the breast cancer. This is pink color cross ribbon will be shown. If we're talking about the diabetes, this is the blue color round logo will be there. This is for the diabetes. This will for the diabetes. Sure, doctor. This PDF will be shared. This PDF will be shared just after this session only. Just after this session only, I will mention the link of the PDF. Okay, I will mention the link of PDF in the comment box and in the description. You will get the PDF just after this session only. Okay, right. And the next we have the National Iodine Deficiency Disorder Control Program, and IDDCP, which is initiated into the 1992, and there will be the salt iodization was from the 30 ppm to the production level, and the 15 ppm for the consumer level. And this is about the national iodine deficiency control program. You can see this logo is saying and having the quote of that Shakti or Buddhi ka Rakshak, and there will be the sun will be there, and it's having the iodine namak. This is the logo of the iodinized namak. Moving forward for the next, which is your Pradhan Mantri Surakshit Matrata Abhiyan, which is also known as your Suman, and it is having the logo and written 9th of every month. This is having a 9th of every month, the free antenatal care checkups of the 9th of the every month. This is run by the government of the India, right? So this is about your Pradhan Mantri Surakshit Matrata Abhiyan, Suman. Then next we have baby friendly hospital. This is the logo for the baby friendly hospital. And then we having the Indian newborn action plan, right? INAP, this INAP logo. And the next we have the National Health Insurance Scheme, which is your RSBY, Rashtriya Swasthya Bima Yojana, right? Please remember this logos. And the important one, this is the important one. You can see in the finger there is the flower is there, which is there, Jindagi Chuno Tambaku Nahi, Jindagi Chuno Tambaku Nahi. This is from the National Tobacco Control Program. This is logo for the National Tobacco Control Program. Okay, this is from the National Tobacco Control Program. Moving forward, this is, I hope you already know, in the COVID-19 there was a mobile application was generated, which is known as your Arogya Setu app, and this is the logo. This is the logo of your Arogya Setu, right? And this is given the name as the Mass Surakshit, Hum Surakshit, Bharat Surakshit. This is having the quote of Mass Surakshit, Hum Surakshit, and the Bharat Surakshit, right? And this Arogya Setu is the mobile application which is developed by the government of India to connect the essential health services with the people in the India to the combined fighting against the COVID-19. This was against the COVID-19, right? So when you all was in the COVID-19 in the different countries, when you come back to India, at the airport only you have to download this Arogya Setu app, and you have to register yourself with your Aadhaar card ID, right? You remember this? So this was about your Arogya Setu app. This is all about your Arogya Setu app. The next thing we have the Employee State Insurance Act, which is 1940, which is from the 1940, which is ESIC, right? This is the Ministry of the Labor, which is Government of India. There will be the contribution. There is the two type of the contribution from the employer and the employee. There is a two type of the contribution will be given. What is the two type of the contribution? This is the 3.25 weightage from the employer, and from the employee it is from the 0.75%. Totally it is the 4%. Totally it is the 4% weightage will be given here. And if in talking about it, there will be the, if I'm talking about the sickness benefit, for the sickness benefit, the 91 days, 70% of the wages will be 91 days will be here. If we're talking about the extended sickness benefit, it will be from the 2 year for the 80% of the wages. And if we're talking about the maternity benefit, it is for the 26 week, which is having the 100% of the wages. This is having the 100% of the wages, which is about the your employee state Insurance Act, ESIC, right? The next we have the National Rural Employment Guarantee Act 2050, which is also known as the Narega, right? And the quote from this Narega logo is having Rashtriya Gramin Rozgar Guarantee Adhiniyam. You can see this is providing the providing the 100 days of employment, more than 100 days of employment per year, right? And you can see the logo is also having the 100 days, and the workers are working in a field and other ways, right? So this is providing you the more than 100 days of employment per year, maximum one member per BPL family will there, and this is having the unskilled manual labor was done by the government. Please remember, this is the unskilled, okay? Unskilled was there. The next we have the integrated disease the integrated disease surveillance project. This is IDSP, right? This is the encompass regular centered periodic surveillance, which is from the syndromic diagnosis and the having the lab confirmed the diagnosis. You can see there's the IDSP was written in between, and this is the logo. Please remember this logo of IDSP, right? This is the logo of IDSP, right? Moving forward, for the next we have the National Disaster Response for, right? ND NDRF. This is your NDRF. So this is from the National Disaster Response, Aapda Seva Sadev, right? This is the quote of this Aapda Sadev, and this is having the campaign. The chairperson is the Prime Minister here, and if you're talking about the nodal ministry, will be from the Home Affairs. This will be a Home Affairs. If you're talking about the nodal center, so the nodal center will be available at the district level, right? The World Disaster Reduction Days, the World Disaster Reduction Day at the 13th October. 13th October will be there, right? Moving forward for the next, this is the disaster management cycle. This is the disaster management cycle. You can see here, this is having the primary phase, which is from the 0 to 6 hours. This is where we can do the first aid and the medical care will be provided. In the second day, follow up, there will be the transportation, sanitation, and the immunization will be done in the secondary phase. And then we have the tertiary phase for the cleaning up, food, clothes, shelters, and the social services and the rehabilitation will be provided in this disaster management, right? So please remember this logo of disaster management cycle. Then we have the recent one, Pradhan Mantri Jan Dhan Yojana, PMJDY. This is also from the Ministry of the Financial Government of the India. You can see this is the logo of Pradhan Mantri Jan Dhan Yojana. Mera Khata Bhagya Vidata, right? This was the quote. This was the quote from the from this from this uh, Pradhan Mantri Jan Dhan Yojana, Mera Khata Bhagya Vidata. Then you're having a UDI Aadhaar, right? Please remember, you all guys are having an Aadhaar card right nowadays, and this is the logo of your Aadhaar scheme. This is the logo of your Aadhaar, right? Moving forward, for the next, you have the Ujala. You have the scheme of Ujala. Please remember UJALA. This is about the Ujala, right? What is the full form of the Ujala? Unnati Jyoti by affordable LEDs for all. This is for the right. This is for the Unnati Jyoti by affordable LEDs for all, right? This is for the Ujala. This is the Ministry of Power, Government of India, which is distributing the LEDs for the affordable price and the subsidized prices, right? This is the LED bulbs was distributed by this Ujala, right? Then we have the Ujjwala. That was the Ujala. Ujala मतलब in the Hindi mean Ujala, it means the light, रोशनी जिसको हम बोल सकते हैं ना, lightness. So that was the LED bulb. The next we have the Ujjwala, right? Next we have the Ujjwala. This is your Pradhan Mantri. Please remember Pradhan Mantri Ujjwala, right? Ujjwala. Ujjwala. Ujjwala, it means the burn, right? Ujjwala, right? Ujjwal Hona, right? So this is the Ministry of the Petroleum and the Natural Gases of the Government of the India, and this is providing you the free LPG connections to the BPL families and the gas cylinders at the subsidized prices, right? So this is about your Ujjwala, right? This is about your Ujjwala. Then we have the Ujawala. So please, Ujala, Ujjwala and Ujawala. Please, these are the three different yojanas. So this Ujawala is having double J, Ujawala, right? This is also having the double J, but this is the Ujjwala, right? This is having the Ujawala. This A is here, right? This A is here, Ujawala. So this Ujawala is having the comprehensive scheme of the preventing the trafficking trafficking and the rescue and the rehabilitation of the victims trafficking, the commercial sex explosions. This is the ministry by this is run by the Ministry of Women and Health Development of the Government of India, right? The next we have the Beti Bachao Beti Padhao Abhiyan. This is the Beti Bachao Abhiyan, and this is this is the run by the Ministry of Women and the Child Development, and this is the logo. This is the logo of Beti Bachao and Beti Padhao, right? This is the logo of Beti Bachao and Beti Padhao, right? That Beti Bachao save the girl child. This is the logo of saving the girl child. This is the different. This is the different part. The next we have Ayush. Then we have the Ayush. The next we have the Ayush. This is the Department of Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. This is the Ayush. So this is the logo of your Ayush. All the stream are together. Ayurveda, Yoga, Naturopathy, right? Siddha, Siddha, and homeopathy, right? So this is about your Ayush. Moving forward for the next, this is about your international day of yoga. This is the international day of yoga. It will be celebrated in the on the day of 21st June, 21st June, right? We'll finish the class at sharp 5:15. 5:15 will be the class will be ended, right? This will be this will be the logo of International Day of Yoga. The next we logo having for the Indian standards sterilization, you already know. This is the ISI mark, you already know. This is nowadays the FSI certification. This is for the food safety and standard authorization of the India, right? This is as every food company should be now under the surveillance of this FSI, right? The next we have the ag mark. This ag mark is the certified mark the employed on the agriculture production, and then we have the Bureau of Indian Standard. This Bureau of Indian Standard, which is the national standard, it is having the development of the activities and the sanitization, marking the qualities and certification of the good and good better connections, right? So this is about the Bureau of Indian Standard. then we have then we have the James Lind. This is the from the James Lind, which is worked on the scurvy and the naval hygiene. And we have the Edward Jenner. We have the photo of Edward Jenner. Please remember, he coined the term vaccination. The important thing, he coined the term the vaccination, and the first vaccine, he developed the first vaccine of the smallpox. Developed the first vaccine of the smallpox. And then we have the Sir Louis Pasteur. We have the Sir Louis Pasteur. This is the father of microbiology. This is the father of microbiology, and he invented the vaccine of cholera, anthrax, and the rabies. Please remember CAR. Okay, cholera, anthrax, and the rabies. He also invented the pasteurization. He also invented the pasteurization, right? Pasteurization. Okay. Moving forward, moving forward, and he gave the germ theory of disease. Please remember, he given the theory of germ theory of diseases. Then we have the Dr. John Snow. Mr. John Snow, this is the father of epidemiology and the father of modern epidemiology also. This is the father of modern epidemiology also. He worked on the cholera, and therefore the cholera is the regulated the father of public health. This is the regards as the father of public health, right? And the National Institution of Epidemiology is have in the Chennai, India, in our Chennai, India, right? Moving forward, this is the triage of the epidemiology, right? You already studied in the epidemiological triad. There is a host, environment, and the agents. This is the triad between this three. Moving forward, this is the web of causation theory. You can understand this is the web of causation theory. Please remember, this is given by the McMahon and the Pugh. This is given by the McMahon and the Pugh, right? This was given by the McMahon. And then we have the multifactorial causation therapy. We have the multifactorial causation therapy, this which is given by your pattern cough, which is given by your pattern cougher, right? Pattern cougher. Then we have the iceberg phenomena. We have the iceberg phenomena. What is the iceberg phenomena? There is a visible. What is the visible? This is the visible diagnosed case. This is a visible diagnosed case, and which is below the water level, which iceberg is having the below the water level. These are the invisible case, misdiagnosed case, under the diagnosed case, or the subclinical cases are there. This is the iceberg phenomena, right? Moving forward for the this are about your studies. This is the prospective cohort study. This is the prospective cohort study. You can understand this is the study participated, then we have the risk factor, then we'll further exposed and the non exposed, and then we'll be getting the outcome and the non outcome. So this is the prospective. Rather than we also have the retrospective cohort study. Also we have the retrospective cohort studies also. We start from the baseline and then we show the will show the at the time of the exposed or non exposed, but study will be started at the outcome. So we'll start the study from the outcome. We start at the outcome. But if it's prospective, the prospective study will start at the present. It will start at the present, and we'll see the we'll see the outcome in the later part in the future, right? And this is the analytic studies. This is the analytic studies which we can do, which is the from the present we can go which we can go backward. This is your case control study. This is the case control study. We start from the present and we'll see the population with this lung cancer and population with the non-lung cancer, and we'll give in the history how much was the exposed and how much was the non-exposed. So this is the backward studies, or you can say the this is the known as the case control study. This is the case control study. Then we have the cross-sectional studies also. Cross-sectional studies also, we can take a sample of the population, and after that we can ask from the we can get the exposed and the known exposed, and then we'll get to the know how many cases are there and how many patients are the in the non cases. Then we have the population distribution curves. We have the population distribution curve, which is the having the developed countries having the spindle shape, which is having the spindle shape. This is seen in the this is seen in the developed country. This is spindle shape will be seen in the developed country, and in the developing country this will be seen in your pyramidal shape. This will be seen in your pyramidal shaped, right? Moving forward for the next about the barrier contraceptives, I already told you this is the male condom, this is the female condom, and this is the your vaginal sponge today, and this is the vaginal diaphragm, right? This I already talked, we already talked about it. This is about the barrier. This is about the intrauterine device contraceptives, right? This is the intrauterine lipis loop, which is nowadays not used because of the because of the failure, and nowadays which is we are using, which is your copper T 380, right? Which is please remember the shelf life the life of the shelf life of the 10 year. This is of the having the 10 years, right? And then we having the third generation IUCDs, which is the levonorgestrel medication IUCDs, which is your Marina, which is your Marina. You can see here, this is the Marina, right? Which is the Marina. Moving forward for the next contraception we have here, this is the Chaya. We already talked about it, Chaya, Antara, and the oral contraceptive, combined oral contraceptive pills. We already talked about in the very brief. Then we have the sterilization. In the sterilization, we have the permanent method of the contraception, and it is having the very less Pearl index, which is the less than 0.1 per 100 women per year. And this is the your which is the tubectomy, which is done in the female. This is the most common method is the Pamros method. What we are doing, we are making the cut in the your fallopian tubes and tidying out it. And then we have in the males, we have the vasectomy. In the vasectomy will be advised will be done, this which is the vasa different will be cutted here. But please remember, just one question for you, which will be advised the post vasectomy. The post vasectomy advice is the use the barrier method for the 3 months or the upcoming ejaculations, right? Understand? Okay, this is about the this is the natural method of contraception. This is the natural method of which is your also known as the billing ovulation method, billings ovulations method, right? Next we have this is about the infrastructure, which is the critical pathway for the long paths in the term of duration. This is the term of the durations. Next, we have the BMW biomedical waste. Biomedical waste, we already talked about this biomedical waste, yellow, red, white, blue, and the black. Okay, please remember the black or the green. Okay, for the general waste, for the black or the green for the general waste. Moving forward, this is for your autoclave. This is your autoclave. For the autoclave, this is having the temperature of 121 degree Celsius at the 15 psi for the 15 minutes for the controlling of the geobacillus and the sternothermophilus, your sternothermophilus, right? Moving forward for the next, there is the measurement of the central tendency. These are the curves. We already the you have the three types of the curve. We have the positive screw, we have the negative screw, and we have the symmetrical distribution. We have the symmetrical distribution. Please remember about it. For the I hope you studied about in this brief in the your PSM subject, right? Very well. Moving forward for the international organization. In the international organization, we have the first logo is here. This is from the WHO, established in the 1945. And this headquarters we are having in the Geneva. And the World Health Day is celebrated on the 7th April, right? 7th April. Next, we have the UNO. The United Nations is this established in the 1945. This established in the 1945. The headquarter we have at the New York. The headquarter at the New York, right? Then we have the UNICEF. The UNICEF is your United National Children Emergency Fund, and this is also having the headquarter at the New York. You can see here the child will be seen here in the UNICEF logo. The next we have the International Red Cross. We have the International Red Cross. You can see here, this is having the red color, pure red color mark is here. Please don't compare with this Suraksha Clinic. The Suraksha Clinic is having a dot here and having the white color, right? And it is also having the headquarter at the Geneva. This is the logo of the World Bank. This is the logo of the World Bank, and this is the logo of the International Labour Organization, ILO. This is the International Labour Organization, ILO, and having the headquarter at Geneva. This is having the headquarter at the Geneva, right? The next we having the Food and Agriculture Organization, right? The FO. This is having the headquarter at the Rome, Italy. The headquarter at the Italy's, right? The next we have the demographic cycles, which we already talked about it. Please remember in the demographic cycle, just you have to remember the India is now in the third stage, okay, which is also known as the late expanding stage, right? Moving forward for the mosquitoes and the larvas, you can see here, this is your female anopheles. This is the female anopheles. This is the larva. You can see this is the female anopheles which is sitting on the 45 degree, of this angle on the surface, and having the black color spots on the wings. Having the black color spots on the wings. And please remember, the larva will should be always the parallel to the water surface, always the parallel to the water surface. The anopheles is transmitting your malaria, the transmission of the vector of the malaria. Talking about the Aedes aegypti, the mosquito, right? Aedes aegypti, the mosquito, you can see this is the also known as the tiger's mosquito. You can write tiger mosquito because it is having a white color spots on the wings and the legs. And please remember, this is the vector for the dengue, yellow fever, chikungunya fever, and the Zika virus. Talking about this, this is the larva which is suspended from the water surface. This is having the suspension from the water surface. This is about your Aedes aegypti. The next mosquitoes we are having the Culex mosquito. The Culex mosquito is for the vector for your Japanese encephalitis and your lymphatic paralysis, right? The larva will be suspended from the water. Please remember. And talking about this is having a hunchback. This is having a hunchback on the backside, right? This is about your Culex. The next we are having the Mansonia mosquito. The Mansonia is for the Bulgaria filariasis, right? And this is having the sparkling legs and the wings. You can see this is the having the sparkling on the legs, and then the larva will be along with the roots and the aquatic plants. This will be always the larva will be on the roots of the aquatic plants. You can see this is the aquatic plant roots, and this is attached to this root of aquatic plants, right? this is about this is about your mosquitoes. The next we have the measles, and you also known as the rubeola. You can see this is the rash of the measles, and this is the Koplik spot. This is the Koplik spot of your measles, right? Measles के बारे में हमने अच्छे से बात कर ली. You can see the Koplik spot. This is about the chicken pox. We already started with the chicken pox and already talked with this, also known as the herpes virus, human herpes virus, right? Varicella virus, and this is the Oka strain. Please remember about the Oka strain, and this is transmitting to the droplets and the airborne. Talking about the next, the method of the communication. You can see this is about the ORS demonstration, and this ORS demonstration will be done in the sociological focused group of the discussion. This is the focused group of discussion should be done in this. The instruments, some important instruments are there which is used in this PSM. This is the wind vane. right? Used to direction of the wind. This is used for the direction of the wind. And then we have the sling psychometer. We have the slings psychometer, which is having the used to air humidity, right? I think image is missing here, right? Please check the sling psychometer. It is different scale type of the structure, which is with the handle, okay? And we have the kata thermometer. We have the kata thermometer, which is for the used for the measure the low air velocity or the cooling power of air, cooling power of air. Then we have the Horrocks apparatus. We have the Horrocks apparatus. This Horrocks apparatus is estimation for the chlorine demand, for the estimation for the chlorine demand. One black beaker for the stretch iodine, for the starch iodine. And then we have the chloroscope also. We have the chloroscope also. This is used for the major amount of free residual chlorine in the water, free residual chlorine in the water. Then we have the nutritional and health. In the nutritional health, we have the biter spot. You can see this is your biter spot due to the vitamin A deficiency seen in the class 1 B will be seen in the one X1 B will be seen. If you're talking about the letharism, this is due to the due to the addition of the kesari dal. Please remember the toxin, the which toxin, the boa toxin, which is the beta oxalate amino alanine will be the boa toxins will be there, which is the your neurological and the skeletal manifestation. Then we have the golden rice. We have the golden rice, which is the rich in the iron and the beta carotene, right? Which is the iron in the beta carotene. Talking about the next, this is the dental fluorosis. You can see this is the normal teeth, and now you can see this is the mild fluorosis. Then we have the moderate and this the severe type of the fluorosis on the teeth. And then we have some important signs are here, which is from the biohazard. This is the sign of the biohazard. And then we have the sign of the radiological radioionization, right? Radiation hazard are there, radiological or the radiation hazards are there, and this is the non-ionizing radiation hazard. So please remember this hazards and this logos, right? Moving forward, for already we talked about it, the point source will be having a rapidly growing and the sudden fall will be there. One only and only one peak will be seen, right, with the food poisoning. And the multi-exposure point source epidemic, there will be the multiple exposure, multiple exposures will be going continuously. There will be a sudden rise and the secondary wave due to the multiple exposure like typhoid in the contaminated water pond and the wall. Then we have the propagated endemic, as we already talked about the hepatitis A, TB, HIV, and and COVID and the COVID, right? About the COVID, right? Then we have the pandemics. We have the pandemics also, right? Sorry, for the COVID is also in the pandemic, not in the epidemics. Okay, COVID was a pandemic, right? So in the epidemic, endemic, and the epidemic, we have the slopes, and the endemic we have the axis in the normal in the growth, right? Moving forward for the next, the trends of the disease we already talked about is the circular trend. It is having the long term fluctuation, so it is having the circularly trends. Like then we have the cyclic trend. It is having increasing and decreasing in every few years, having the periodic fluctuation. Then we have the seasonal trend. We have the seasonal trend, which is the also having the periodic fluctuation, right? Every seasonals will be the trend will be followed by that. Then we have to talk about the louse. Louse is transmitting disease, the endemic typhus, relapsing fever, trench fever, and the periodis, right? So you have to remember the periodis capitis with the head louse, right? Periodis corpus, which is the body louse, and we have the periodicus pubis, which is your crab louse, right? This is about the louses. Then we have some vectors, special vectors like the sand fly, which is causing your kala azar, which is causing your kala azar, which is causing your kala azar. Understand? Then we have the Reduit bug. We have the Reduit bug, which is your American trichomoniasis or causing the trichomoniasis, which is also known as the Chagas disease, which is also known as the Chagas disease. And the third one, we have the red fly, which is transmitting your bubonic plague, which is the bubonic plague, and the endemic typhus and the chigiosis, right? Moving forward for the ticks, as the ticks also transmitted diseases, the soft tick is having the Q fever, Canor frost diseases, and the relapsing fever. With this, we have the hard ticks also. Hard ticks in India. Please remember the Koinur Foster's disease in outside the India by the soft tick, but in India it is by the hard tick. It is by the hard tick. Indian tick typhus and babysinosis, tick encephalitis, and the tick hemorrhagic fever will be seen in the tularemia also. The sampling, if you're talking about the sampling, there's a different type of the sampling. The first will be the simple random sampling, and this You can see the simply we randomly took the peoples from the population. This is the sample randomic population. This is the systemic control, systemic random. What is the systemic? We, after the sample of every three, first we choose the second one, then we choose the fifth one, then we choose the eighth one, then we choose the 11th one. So this is the I will give you the example, just a minute. So we'll choose the people from the population from the every symmetrically, right? Symmetrically will follow a pattern for the random sampling, right? Then we have the sampling, which is the stratified random sampling, which is done in the various in data. Like we have to choose we have to choose the sampling from a person to person variable, right? For the groups we divided, and in every group we choose a one and one from there. Then we have the cluster random sampling, which is done in the various clusters. So we'll make the clusters, and the cluster population will take the sample of the two cluster, will take the sample of the two clusters will be chosen together, right? This is about the sampling. And then we have the statics graphs. Please remember about the statics graph. This is your histogram. This is the histogram. This is not having a space between the bars. Please remember about the histogram. This is histogram is your pyq. This histogram is your pyq. Then we have the frequent polygon. This is your frequent polygon, and this is your frequency curve. This is your frequency curve. Please remember about the statics graph, especially the histogram. I'm making the question mark here because this was your previous year question. Talking about the next static graph, please remember this is your simple bar chart. You can see this is having a space between this bars. This is your simple bar chart. If this bars are all the together, this will be known as your histogram. And then we have the next multiple bar chart. In the multiple bar chart, you can see the multiple bars are together, then this is having the space, then again this is having the together, then again it is having the space. So this is known as your multiple bar chart. This is known as your multiple bar chart. Then we have the component bar chart. Then we have the component bar chart. In this component bar chart, in a one bar only, we having the different components. We divided into the different components, and this is that's why this is known as your component bar chart. This is known as your component bar chart. Then we have more static graphs are there, which is like a line diagram is there. You can see this is the line, just simple line is there. This is the line gram there. Then we have the or given. What is the or given? This is having the having the cumulative frequency diagrams are the frequently only seen increasing. So the frequency will be always in the upside. This will be the upside is growing on. Then we have the scatter diagram. In the scatter diagrams, you can see there is the one line will be there, and there will be the some dots or the some points will be above the line, scatters line, and some will be the below the scatters line. This will be your scatters diagram. Then we have the statics graphs will be there. You can see like your stem and leaf plot will be there. Like you can see this is the stems and this is the leaves of this plots. And then we have the funnel pot. You can see this is the type of the funnel shaped pot. This is a funnel pot. And then we also have the forest pot also. Then we have the forest pot also. With this, please remember this is the important one, which is your box and whisker plot. This is also your pyq, right? Box and whisker plot. You can see these are the boxes and the whiskers are here, right? And then we have the pie chart. We have the pie chart, one circular 360-degree circulation circle will be there, which is going to divide it into the different percentage, which is your pie chart. This is your pie chart, right? So that's it for this session. And if you have any queries related to this session, let me know. You can contact me directly on my Instagram. My Instagram handle is Dr. Vaibhav Ahuja, and my Telegram username is also Dr. Vaibhav Ahuja. Just when I'm sharing this PDF, I will attach 5 to 10 important MCQs also with this PDF, right? I will attach 5 to 10 MCQs also. I already put it MCQs here, right, to practicing you, right? आप लोग देख सकते हो यहाँ पे मैंने already 5 to 10 MCQs यहाँ पे डाल रखे हैं. So you have to practice this important MCQs. Okay, you have to you have to do this important MCQs. This 10 important MCQs I put it here, right? Okay, guys, that's it for the session. And you guys can contact me directly on my Instagram and this on my Telegram username. Okay, guys, and as just day after tomorrow you guys are having the exam, right? So best of luck from the Meduhub team, and the best of luck from my side also. I'm your Dr. Vaibhav Ahuja, right? And best of luck for your exam. uh, don't be in hurry. आराम से एग्जाम करना है हम लोगों को, ठीक है? And in both of the parts will be good, and please try to cover all the things which you have left till now. Try to cover up that, and that's it for you. Okay, guys. Thank you so much for this session, and we covered all the important points of our PSM subjects. Right, guys? Okay. Thank you so much, and best of luck for your exam and for your preparation. Right? Best of luck.